Доброго ранку, друзі. Сідайте, будь ласка. У нас за хвилинку часу почнеться пряма трансляція. Тому я дуже попрошу тишу в залі. Добре? Добрий ранок, шановні друзі.
So good morning, dear colleagues. We are about to start. Our live broadcast is about to start. So I would like to express my gratitude for your resilience, for your courage. And I hope that today is also going to be a rather informative day, a rather interesting day. And I would like to address all those staying with us online. If possible, after lunch, find some color pens or markers, and we will have to work at ourselves. We will be looking for our own resources that could help us fill ourselves from the inside. And now let's continue with our event, with our conference that is dedicated to the European Cystic Fibrosis Awareness Day, which is entitled the Day of Cystic Fibrosis Awareness in Wartime. And I would like to express my gratitude primarily to Lviv residents, the people who are living here. Thank you, guys. Thank you, dear physicians who are rather hospitable and who are holding the rear in order to host all Ukrainians. So let me invite the head of unit of All Ukrainian Association from Lviv, Lesa Moroz, and she will tell us about their activity. Good morning to everyone. I'm happy to see all of you in Lviv. So it's my first time that I have a report at conferences like this one. And the topic is the challenges on overcoming of the obstacles in the war period. Well, war in general is something we were not ready for. Everybody kept talking about it, but anyway, it came unexpected. And there appeared a lot of challenges. Now, we have very tough times for all Ukrainian households, and if this is a family having some orphan disease, that is a double challenge. And I remember when the war broke out, my son, who is 6 years old, told me, "Mom, and when you were a child, what was happening there? What is about this war? When is it going to end?" It has not yet ended. We don't know when the end is coming, so we are facing a rather difficult period of time, but we will survive and everything's going to be fine. Since the very beginning, Lviv and our hospital, which is the Western Ukrainian Specialized Pediatrics Center, became a real medical hub for all children. In particular, we had a lot of children coming from other regions, the ones located closer to the front line and to the occupation. And our hospital was a hub where they stayed and then moved on to some other places, either abroad or to some other places in Ukraine. In these pictures, you can see our patients who were undergoing treatment in our hospital during the first days of the war. The mother and the child from Cherkasy, this is our patient, Christina, and another boy for whom we brought oxygenator because it was difficult for him to breathe. Evacuation of severely ill children abroad. How was it arranged? We compiled the lists, and every physician, well, actually, it was me who called Ludmila, and then Ludmila gave a call to everyone else asking whether they were intending to leave or to stay, because nobody knew what was coming. So we compiled the list of groups. Many countries volunteered to help us, where there were a lot of organizations willing to help us, so our patients were leaving for abroad. They were going to Poland, Germany, Italy, and they were supported and accompanied by their closest relatives, and that's the way the evacuation was arranged. In this slide, you can see our patient from Lviv. You know that there were great queues at the border. People were uncertain about what to do, and so they stayed at the border for some 3 days in order to cross it. And in this picture, you can see a patient who was in severe, grave condition, and he was taken to Italy through a green corridor. So here you can see how he arrives in Italy, and he is already with doctors. Everybody was meeting him there. Here is a girl not from Lviv region, and during the war she was treated at in our hospital, and following this evacuation list she went to Italy. You can see such a beautiful girl. And in general, almost all of our patients stayed in Lviv, and even the ones who left have already returned. But those patients who are staying there, when we communicate with them, they really miss their country, their language. They want to return. In spite of the war, the motherland is calling them to return. And let's have a look at how it all started. Of course, war is the period of uncertainty. And for us, um, as for mothers, the first question was, what comes next? Will we have medicines? Will they be able to provide further medications to us or not? And it was within several days that we started getting large packages from patients from Europe. We know that in Europe, medicines are not just given without the prescription. You cannot buy them there. It was necessary for them to approach their doctors to get this prescription, so that's what they did. And they send their own medications to us, in spite of the fact that the state was allocating those medications specifically to them. So my great thanks go to all the patients from Europe who did it. In the first days of the war, Lviv region came to realize that we are located a little bit remotely from the front line. With us, it was dangerous, but still safer than in other regions. So we came to realize that our task over this period of time is to be helping other households from other regions that have patients with cystic fibrosis. So here you can see Helena Markov in the picture. Unfortunately, I don't see her. She hasn't arrived yet, but she, together with her husband, since the first days of the war and up till now, has been actively supporting us. They have given us the premises for sorting. There were special conditions. They arranged the right temperature mode for sorting, packaging, and storage of medicines that were brought by the charity organizations from different corners of the world. And her husband went to the border to pick up the medications. He also was involved in transportation of our elderly patients abroad, or not elderly, but those who were older. And we got the first aid. Well, the war started on the 24th of February, and it was about the 3rd of March that we started getting large packages of aid coming from other countries. First of all, those were our Polish friends, and we are really grateful to them. Mukohel, Pavel Wojtowicz, Mateo Foundation, Polish Society, okay, with cystic fibrosis. Maybe I'm wrong in the pronunciation. Muko Coalition and Polish Patients. These were the people in the organizations that sent us the first packages. So we are really grateful to them. Here are the next pictures. So, packages started arriving with medications, oxygenators, inhalers, vitamins. And in the first picture, you can see a girl who got the oxygenator brought from abroad. The packages were brought to Helena, and in this picture, it's described how we were sorting out inhalers and sending them to other regions like Zaporizhia, Dnipro, Kharkiv. We collected the demand and then sent those packages. And here you can see the leading specialists coming here to Lviv in order to sort out the medications by active substances, and they decided what was needed in this or that region and send those packages. Practically all of us has heard about the Atomspende charitable foundation, which is the German charitable foundation, and they have really helped us a lot. They arranged a lot of trips. They brought a lot of medications, oxygenators, inhalers, and every child seems to know about this charitable foundation. In this picture, you can see, well, it seems to me it was the St. Nicholas Day in Ukraine. It was very cold. It was -8, I guess. But the representatives of the charitable foundation Atomspende stayed on the border for about 9 hours to cross our border, and then they could not get to Lviv, to the center of Lviv, because of the worst of the bad weather conditions. But they brought generators, they brought some medications. Also, we were provided support by the Italian foundation. This is Fondazione Ricerca Fibrosi Cistica, and you can see Lyudmila here in the picture with them. What about blackouts? Nobody was ready for that. That was the first time it happened that we had a mass blackout throughout the whole of Ukraine. Of course, all our children depend very much on light and electricity, and blackouts, power cutoffs, were a problem that needed to be solved because they needed inhalations. And you can see the inhalers brought to us. We send them further on to other parts of Ukraine for severely ill children. In the first picture, you can see our Christina Maximchuk, and in this picture, which is rather vague, she's staying in the shelter with the oxygenator. It's very cold, so we covered her with different blankets. That was the previous winter in Ukraine. Well, in general, a lot of support was provided from Fari company. We got new inhalers, some portable inhalers, the sets of changing parts, and here you can see our patients happy and merry. In this picture, you can also see some children. On the occasion of St. Nicholas Day, our Ukrainians staying abroad who don't forget about us send those gifts to our patients, and thanks a lot to them because they glorify us, they keep telling about us, they give some money to us. And here is the German Ukrainians Union Kolos. They organized gifts for our children with cystic fibrosis for St. Nicholas Day. These were some sweets. And another important thing is that on the 12th of April, there was a visit to Lviv of the representatives of Direct Relief Charitable Foundation. The goal of this visit was to support our patients with Trikafta medications. So this visit was the first visit during which they signed an agreement on provision of medications with specific requirements, terms, and conditions concerning preparation. And this is all about Trikafta from the Vertex company. And at the end of August, that we got the first consignment of those medications. You can see happy doctors who are getting the first tranche. And these miraculous medications have already been given to some of our children. And now I would ask you to show a video for you to see how, in spite of martial law, in spite of war, in spite of all the challenges we used to have before war and in wartime, let's watch this video with our patients. Hello, I'm Zlata, and this is the daily life of a child with cystic fibrosis. Daily inhalations, a bit of medicines, and also creon. Maybe not a bit of medicines to give you power and to have the appetite. And magic savers. Wait. And you can see how, thanks to all this, I'm living a full-fledged life. Here it is, so you can see one of our patients who is a very gifted girl, and thanks to our physicians, to her mother, she is living a full-fledged happy life in spite of all the difficulties and challenges. And I can see that Ludmila Bobar has joined us already, and we have Olena Vashchuk, so we would like to express our gratitude to both of you with our applaud and flowers for what you do. For what you're doing, because you know that you are really precious for us. We respect you, we love you, and wish you to stay in good health, and we wish you good luck and everything. And thank you for our children. I'm really grateful, Lisa, to you for such an informative presentation. It seems to me that this is just the top of the iceberg, because all the other work that has been done is being done now at the moment. Even today, it will be done tomorrow, the day after tomorrow, in the next weeks and years. Just this work is invisible, but that is really a lot of work, and we really use all our energy to improve the situation. Each of us is working towards improvements. We want to influence the situation which unfortunately we have in our country, but everything is going to be fine because the unity we saw at the beginning of the war keeps supporting us and inspiring us towards new achievements and further activity. Thanks a lot for your presentation and for what you do. Thank you for the invitation. So let's continue with our event, and before I give the floor to our colleagues from CEOP Europe, let me say that we have got and we keep getting huge support. Support in terms of friendship from the people whom we knew only through conferences. We had some superficial communication. We didn't have any face-to-face communication. We were facing some restrictions, but now, over the whole period of the war, they have been supporting us. I would like to express my gratitude to all the friends and colleagues from CF Europe and to all the representatives of all countries, different countries, who really perceived our grief as their own grief and problems. They were responding to our telegram messages in the night time, in the morning. They always stayed in touch with us. So thanks a lot for giving us this opportunity to tell the whole world what is happening in Ukraine and what our children, our adults have to experience. All of us have to experience. That is really the support that gives us energy to move on. So let me invite our colleagues, Hilda, Lydia, and Philip, who who is the president of CF Europe now. You're welcome.
Thank you very much, Larissa, for this beautiful introduction, and thank you everyone for organizing this impressive conference, and thank you also for all those attending. We are very glad to be here, and we are incredibly grateful for your work and for your words right now. So I will just leave some space for my colleagues as well to introduce themselves. Hilda, if you'd like.
Thank you, Lydia, and good morning, everybody. It's an honor to be here with you today, although not in person, but through video. I'm glad I can be here. As Larissa already said, we are Hilde, Lydia, and Philip. I'm Hilde de Keyzer, CEO of Cystic Fibrosis Europe, the European Federation of Patient Organizations of People with CF. And for many years, we have been in contact and we have been working together with the Ukrainian CF patients in conferences and in a good way. Also with many other patient organizations from the region. CF Europe started 20 years ago and built to become a strong patient community together with all people with CF across the countries where we have member organizations. And that is how this shared experience we had for many years and the trust that we built for many years amongst people with CF from the different countries, that when it was most needed, the patient community across Europe was there, was ready to join forces and to bring together knowledge, expertise, but also to raise funds and to organize itself to try and face the situation that you face since February 2022. And Larissa and the other colleague already thanked indeed many organizations that work together. And there were many more, and Lydia will go into more detail on how we worked on this and how we tried to bring everybody together to help people needing CF care, CF treatment, but needing many more things. So I'm grateful that we were colleagues and friends for years before the challenges started, before the war started, and that in that way, together with our friends and colleagues in Poland, in Romania, and many other countries, we could try and bring together some help, some support. And it's, as I said at the beginning, our honor to be here and to give you a little insight on what we've done and how we try and will continue to try help people with CF in Ukraine and across Europe. I think, Lydia, we were supposed to pass to Philip now.
Yes, I don't see Philip connected, so maybe I can go ahead and talk a little bit more about the work of CF Europe. specifically. So thank you very much, Hilda, for introducing this. I joined CF Europe in March 2022 as a response to the situation in Ukraine. So I have to say it was an honor to be able to coordinate the response from CF Europe from the start, really, from just a little bit after the start of the war. So for CF Europe, as Hilda was saying, as the Federation of Patient Organizations, our work is, of course, that of representing the voices of people with CF across Europe. In this particular situation, we responded to a phase that was, of course, unexpected for everyone. And we initially started trying to understand how we could help and how we could best be present for people affected by the war, both in Ukraine and for those fleeing the country. And I have to say that what was impressive for us from the beginning was seeing really the European CF community really strongly coming together. We received a lot of offers of help from organizations all across Europe, and also from individuals, from pharmaceutical companies. Everyone really was coming to us to ask how they could help, how we could work together, how they could donate funds or medication or aid. So this was a really impressive reaction from our side. We also had a lot of organizations, European organizations that came forward, and we tried to understand how to collaborate with them in order to find solutions, because from our point of view and from our positions, of course, we had some difficulties initially to understand what the needs were, what the changing needs were in the country of Ukraine. As Larissa mentioned before, previously we had a very deep contact, but of course we are based in Belgium, so for us also to understand what were the needs took a little bit of time. But it is thanks to the efforts of the Ukrainian Association and in particular its president, who never stopped to really support people and their families, and also to be a point of reference for us, to really keep us informed, to give us information on the number of patients in the country, the number of patients that were living, and what were the most urgent needs. And she really facilitated our work in this way. So we're very grateful for that. We were very pleased to recognize the efforts of the association and of the president, Larissa Voloshina, with the award of a Patient Advocate of the Year this year in June in our annual meeting. We kind of strengthened our collaboration, I think, throughout this past year and a half. And we also strengthened our collaboration with other patient organizations, and we are extremely grateful for their work since the beginning. So, for example, the Polish Association, the Slovakian Association, or the Czech Association, Romania, Moldova, many patient organizations and representatives, too many to name. And of course, Atomspende, which was already mentioned in the previous presentation, was really central in providing support for people with CF. So we started collaborating with them since last summer, and really tried to bring all our resources together to see how we could communicate directly with doctors in various regions and with patients. On the other side, when talking about the community coming together, we were very impressed by member patient organizations of CF Europe in Western and Central Europe. So, for example, the Irish Association or the Spanish or Belgian or Italian association that was named before, and others that were also helping patients and family that were looking for possibility to move to other countries for treatment or for testing. What I have to say is CF Europe also learned a lot throughout this process. So, of course, we understood that as a Federation of Patients Organization, we had a kind of a new role to play as well, and a role which is related to being able and ready to respond to challenges that are beyond any of our control, beyond the control of the community at the European level. So we started understanding that we need to really have a role in supporting patients' organizations in a systematic way, also when there are socioeconomic challenges, when there are unexpected circumstances, as the war has proven. And it's with this in mind that we started a new project, which has just started now, which is an expansion of a twinning project. So a project where we aim to twin CF centers and patient organizations in Eastern and Western Europe to share knowledge and to share resources and to support each other really also in moments of particular crisis. So this idea is a project funded by the Cystic Fibrosis Foundation in the US, where we collaborate with the European Cystic Fibrosis Society. And we will be working on this over the next 3 years, trying to really strengthen the connections between CF centers and patient organizations. And our learning, I think, from the work of the last year and a half is really to be even more of a federation that strengthens the CF community going forward, providing, for example, resources, online resources or events where we can all come together. So as Hilda was saying before, we are determined to continue supporting patients and their families affected by the war in every way we can. And we are extremely grateful to be able to do it thanks to the work of the Ukrainian Association and the associations in neighboring countries and all across Europe.
Дуже
Thank you.
дякую. Дуже дякую, Лідія, дуже дякую, Хільда.
And I also want to remind you about the opportunity to join on an interesting speech after lunch. It will be a speech dedicated to the search for one's own resources. I think it may be a speech interesting for every person. So if you have the time, please feel free to stay with us, and we are happy to have you here with us. We hope everything will be okay. Thank you. And we're moving on. We are proceeding with our conference, and I would like to give the floor to Professor from the city of Poznań, who will deliver his speech on the topic Adult Life with Cystic Fibrosis, Problems, Challenges, and Prospects during Modulated Therapy. And it would make sense for our colleagues from Poland to properly introduce the honorable professor, because I may make a mistake in pronouncing the name. So we are inviting Professor Dr. Szczepan Kofta. Я сьогодні дуже радий бути з вами. І хотів би поговорити про те, як виглядає
I will speak about problems, challenges in the era of modulators. I have a pleasure to be ahead of the Department of Respiratory Medicine, Allergology and Respiratory Oncology. And I'm responsible for one of the greatest adult centers in Poland. In Poland we have more than 3,000 patients with cystic fibrosis. More than one-third of patients are adults. And we are taking care of 130 patients with cystic fibrosis in our new center, especially for Western Poland. We know what is sufferers of cystic fibrosis, and last 1 year we had a perspective in Poland to start a program of using modulators for our patients. We are taking care of about 95 patients with modulators which are under our care, and that situation of use of that drugs changed the situation of that patients. Normally we had 12, 14 hospitalization per month of patients with exacerbation of cystic fibrosis. Nowadays we have 40% of that which was before 1 year ago and more. Adults with cystic fibrosis, they have more respiratory and multi-organ changes. We can see it on chest X-ray and on CT scan. It will lead very frequently to respiratory insufficiency, to necessity of lung transplantation. But nowadays we had 4 patients with cystic fibrosis on waiting list for lung transplantation after the beginning of use of modulators. We have only 1. As we are here together, we all know pathogenesis of cystic fibrosis, defective gene, defective safety modulator, inflammatory pathology, which will lead to bronchiectasis and to, on the level of respiratory tract, the destruction of respiratory tract. But I like very much that slide taken from European Respiratory Society monography. The complexity of clinical imaging in cystic fibrosis is very eminent, and we have in our respiratory care patients with respiratory pathology, and respiratory pathology is in 90% of causes of death. But there are another aspects which are presented on that slide, psychological, psychiatric, powiatowe, intestinal, genitourinary, reactive to bones and joints, sinusitis, vascular, pancreatic, renal, and also risk of lung cancer is in non-transplant patients in and they have more evident in that patients, and if someone is under lung transplantation, is 17 times more present. We have different standards I will present you, and I think that it's mentioned very much that European standards are very important to use in our clinical practice. It's also a guideline related to infection prevention and control guideline. It's 67 pages. Assume all fibrosis have specific pathogens. We know that staff can have gowns and gloves. Patients should use masks. Always 2 meter separation when we are performing spirometry and other lung function testing. We have we should have 30 minutes between patients. We have also our Polish recommendations. They are old recommendations, but we are thinking always when we are taking care of patients what we should do to that our patients will live longer and better with cystic fibrosis. We know that elements of our improvement of care is optimal nutrition, antibiotics, techniques of rehabilitation, therapy, dedicated centers, better diagnostic tools, transplantations. But what's new is disponibility of modulators. It's changed a natural history of the disorder. It was and it is really the revolution. In Poland, we have very good pediatric care, but we are working for dedicated also other centers. We had 3 in the beginning in Radka, in Mantus, in Warsaw and Poznań. But nowadays we have at least 10 different centers in different parts of Poland. If we have now more than 1,000 adults with cystic fibrosis, and when we count that every center should have more than 100 patients under care, we should have 8, 10, 15 new centers in different parts of Poland, and we are waiting to receive that situation. When we perform cystic fibrosis adult care, we are thinking about bronchopulmonary exacerbations. We think about interdisciplinary care challenges, treatment complications, respiratory failure, which is our challenge, and lung transplantation. We know what is the structure, what is the situation of bronchopulmonary exacerbations. It's the use of antibiotics, the therapy, politics, antimicrobial drugs, and tools of isolations. We know that our pathogens are very different, that we have in more than 50% of patients Pseudomonas aeruginosa, in groups of adults, not so many, because there is a complex, stable percentage of chronic Staphylococcus aureus. There are a lot of pathogens, especially we have resistant gram negatives, which are very dangerous to our patients. It's the art to use and to have a good standard of care in pulmonary exacerbations. The second point is interdisciplinary care challenge. We have, which also on the left side, we have medical challenges, but also on the right side, non-medical challenges related to education, work related marriage, financial support, medical legal problems. Medical challenges are respiratory, gastrointestinal, ENT specialist, diabetes, osteoporosis, fertility. The care of adults with cystic fibrosis is the situation like the puzzles which can be removed, which we always improve the situation of cystic fibrosis patients. Cystic fibrosis treatment of adults, it's treatment of complications. Here you have a structure of different situations. Diabetes, which in age of 50 is in 45 patients. Its knowledge of celebrities is necessary. Sinus diseases in more than 35%. Bone diseases with age is percentage elevated. Arthropathy is elevated. Coronary heart disease increased. Depression, about 1/4 of patients. Liver disease, silent, and all pathology, also chronic kidney disease. And age of 50 is a situation of 10% of patients. Cystic fibrosis complications is pneumothorax, hemoptysis, respiratory failure. Respiratory failure which lead to oxygen therapy necessity, to mechanical ventilation. In non-invasive ventilation we use in practice, and invasive ventilation, and the last resort, the last step, it is lung transplantation. In our center we perform an embolization of arteries which are the cause of bleeding, broken arteries. It's the patient on the left before and after the embolization. After the embolization, we have a success of 4 years. The recurrence is only about 25-30% of complications. What is the most difficult in respiratory care of cystic fibrosis patients is respiratory failure. The patients are using concentrators. It's one of our patients. It's also possible to use liquid oxygen. It's another situation. The rules of propagation of long-term oxygen therapy it's like in the situation of other respiratory pathologies. PO2 should be less than 55 millimeters per mercury, or 60 millimeters of mercury. The situation of signs of pulmonary hypertension. Our challenge is to have portable also concentrators. Respiratory failure is also a place for non-invasive ventilation, which is used vastly in the clinical practice. The last element of cystic fibrosis adult care is lung transplantation. It is one of the most difficult questions in our practice because we should answer the question, is the stage of disease the indicator for lung transplantation? And the stage of disease is not contraindication for successful transplantation. It should be not too early and too late. We are deciding about cystic fibrosis patient transplantation when the risk of death for them is about 50% in 2 successive years. In this, to distinguish and to look for the best moment for transplantation is really a big problem, but we know that the result of lung transplantation.
Знаємо, що результати трансплантації легеней у пацієнтів з муковісцидозом кращі, ніж іншим пацієнтам з іншими орфанними захворюваннями. І рівень виживання складає близько 80% після трансплантації легеней. І в нас в Польщі є 3 центри, які займаються трансплантацією легеней. Це Гданськ, Забже і Щецін. Також у Познані і в Варшаві ми займалися трансплантацією легеней, і там також було 2 центри. Як я вже зазначив, ми продовжуємо життя наших пацієнтів за рахунок трансплантації легеней. І оскільки ми зараз використовуємо бронхіальні модулятори, то, власне, якість цієї процедури також покращилася. Власне, була ситуація така, що пацієнти могли вмирати після, у нас був один пацієнт, який через 4 роки помер, але ці 4 роки його життя були якіснішими після трансплантації легеней. Якщо говорити про історію, природну історію муковісцидозу, то досить складно визначити, якою є ця природня історія. І ми можемо говорити тут про неопластичні розлади, про деменцію, яка порушує фактично здатність людини до життя. І ця деменція, якщо ми говоримо про пацієнта з муковісцидозом, дуже швидко погіршується, стан погіршується. Ми стикаємося з багатьма проблемами, які стосуються термінального етапу життя пацієнта. Тому що ми фактично діємо, ми ставимо запитання, але ми говоримо про молодих людей. Ми використовуємо антибіотики, ми даємо різні рідинні препарати, ми забезпечуємо поєднане, змішане лікування, даємо певні агенти для запобігання захворюванню, але, звичайно, що виникає запитання, як використовувати неінвазивну вентиляцію, як використовувати інвазивну вентиляцію. Якщо це, наприклад, вже 5-й раз пацієнт показав, що в нього є контрапокази до цієї процедури. Щодо трансплантації, то ми можемо сказати, що це найкращий варіант вирішення проблеми. Ми досить часто вдаємося до цієї процедури, знаємо, як використовувати ЕКМО. Як тимчасове вирішення. Але ми дуже раді, що, власне, завдяки використанню модуляторів ми змінили історію, ми змінили сьогодення. Центри муковісцидозу повинні бути обладнані різноманітними препаратами і інструментами для того, щоб, власне, виконувати всі необхідні процедури, такі як ендоскопію, спірометрію і так далі. У нас в цих центрах має бути пульмонарна служба, має бути можливість для проведення кисневої терапії, механічної вентиляції, доповнення дієти. І в Польщі, ось ви бачите, це наша перша можливість, коли ми скористалися таким лікуванням для пацієнтів з муковісцидозом. Це було непросто, але тим не менше ми почали застосовувати таку терапію. І в нас навіть було кілька пацієнтів з України. Ми їх також лікували. Наш центр з муковісцидозом забезпечує диференційовану опіку, тому що це і стаціонарне, і амбулаторне лікування, і змішаний тип лікування, і догляд за пацієнтом на дому. І ми проводимо медичний контроль кожні 3 місяці за кожним пацієнтом. У нас зараз створено новий центр. Ми створили окремі кімнати для пацієнтів. Ми також маємо соціальні програми для своїх пацієнтів, створюємо умови належні для пацієнтів. Але можна сказати, що менше 60% наших пацієнтів
to use of modulators, it's less patients. The last words about our experience with modulators, it's a revolution. It changed the natural history of the disorders. even the patient will have less mucus inside in the bronchial tree. That bronchial tree, when performing bronchoscopy, with bronchoscopy, that patients have no mucus, less mucus. It's a problem with sputum examination. So we are performing bronchoscopy to receive samples for spirometry. There's also chloride test to detect if the patient he is using drugs. We have in the situation of modulators, when we are asking patients every 3 months to come, we have a good standard of taking care. But for the patient with cystic fibrosis, it's always very difficult. Here, there are on the skin of our patients, vivere micarias, dum spiro, spero, there and with us. Life is a struggle, but life is love. It's written on the skin of one of our patients. So at the end, greetings.
Отже, наприкінець хочу просто передати вам привітання з Польщі, конкретніше з Познані. Я вже відвідував Україну, фактично 2 рази, бував в Україні зі своїми презентаціями щодо муковісцидозу. Якщо ваші лікарі захочуть, щоб ми поділилися з ними своїм досвідом, ми завжди будемо раді це зробити. І я, зокрема, відкритий до того, щоб допомагати вам дбати про ваших пацієнтів. І ми самі дбаємо про ваших пацієнтів. Зокрема, у нас є пацієнтка з України Олена, вона художниця. Я можу назвати своїх пацієнтів по іменах, тому що я з ними дуже добрі контакти налагоджую. Бажаю вам всім всього найкращого в ці складні часи, складні для всіх нас, для України в першу чергу, але також і для Європи. Але ми сподіваємося, що майбутнє дасть нам нові можливості. Дуже дякую.
Вам дякуємо за змістовну доповідь. Я думаю,
So we are joined by the president of CF Europe, Philip. He is also the president of CF Ireland. And since this year, he will be representing CF Europe as the president. Philip is with us. The floor is yours. You're welcome. I'm happy to see you, Philip, and I hope we will see each other in the near future to be able to talk offline. Всім доброго ранку. Вітання з Ірландії.
I'm delighted to be able to join you this morning, and I'm only sorry I couldn't make it to where you are because of family reasons, but I would very much hope and like to travel to Ukraine at some stage over the next year to see you all. I think it's absolutely fantastic that the work you're doing in such difficult circumstances, and I just want to express our support and best wishes and solidarity to you at this very difficult time. We were delighted to see one shaft of light, which is the fact that Vertex have agreed to donate Kaftrio Trikafta to people with cystic fibrosis in Ukraine. This is the first time that this has ever happened for the Vertex company, and it also sends out a positive message of support from pharmaceutical companies for people in need, and we hope It is a principle that will help to inform their work going forward as well in other countries where the drug can be made accessible at a price which countries can afford. I was delighted to be involved in drawing up the strategy for support for Ukraine, and I'm absolutely delighted all the work that was done by countries like Poland, like Slovakia, the Czech Republic, to help support you in your hour of need. And we were also very happy to support people from Ukraine with cystic fibrosis who came to Ireland. We know of at least 4 people who came with their to Ireland to seek refuge and support, and we were delighted to help those people in a modest way. So I just wanted to say you're very much in our thoughts. We were delighted at the response of other CF associations to help you in your hour of need. And I know it's only a drop in the ocean in terms of your needs, but we are there for you, and I want to wish you well for the rest of your conference. Thank you.
Дуже дякую, пане Філіпе. Сподіваюсь, ми скоро зустрінемось. І сподіваюсь, до того часу ми будемо мати перемогу не лише
just in treatment with Trikafta, but also we will have victory of Ukraine in this war. And thank you very much for your overwhelming support. So, dear friends, the time has come for a coffee break. We will have 30 minutes for the coffee break. We will resume our conference at 11:30, so you will have some time to rest, and I'm asking you to be back on time. We are resuming at 11:30.
So, colleagues, let's continue. Please take your seats. We continue our event. And I would like to invite Anna, our doctor, our friend. She's been staying with us all the time, and she has dared to come to Ukraine. So I would ask you to take the floor.
My name is Anna Feketova, and
І для тих, хто зі мною не знайомий, тому що насправді в мене тут багато друзів і знайомих, які мене вже дуже добре знають. Я хочу сказати, що я представляю Словаччину, а саме Кошице. Я директор дитячого центру з муковісцидозу. Коли я побачила цю карту Європи, я помітила, що наша країна дуже маленька країна на тлі всієї Європи. В нас лише 5 мільйонів населення і 3800 пацієнтів з муковісцидозом. Із цих 3800 десь 50 чоловік – це дорослі з муковісцидозом. У нас 6 центрів, 3 центри для дорослих і 3 центри для дітей. Тобто це на сході Словаччини один центр, на заході Словаччини і посередині, по центру Словаччини. А я представляю, власне, східну частину Словаччини, саме місто Кошице. Я працюю з муковісцидозом вже дуже багато років. І коли я приїхала сюди і послухала ваші промови, ваші презентації, результати ваших досягнень, я справді зрозуміла, що я от просто захоплююся тим, як вам вдається досягати таких показників, як вам вдається формувати історію успіху, чи то в часи коронавірусу, чи то в воєнному.
power to do it. You, your parents, your association, your doctors, really how you are. And I will speak about our current experience with treatment of cystic fibrosis. And I am very happy that today your doctors will start to speak about your experience with this treatment. Not very long experience, but that you have this treatment here. Because as I spoke with Ludmila, it's really miracle, this treatment. Miracle for patient and miracle also for us as a doctors. When I listened to this last speech from Poland, from this adult center, I was very happy that I am pediatrician and I have center for children, because we are really very happy we didn't lose any patient since a few years. They become adults, and that our work is very nice as work with children. I want to start only to speak a little bit about cystic fibrosis. I know that everybody in this room knows what is it, but I want to say that it is progressive genetic disease that affects not only lungs, but pancreas and also other organs, as for example, reproductive organs. Cause of this disease is gene for cystic fibrosis, and this gene produces CFTR protein, which is chloride channel. If this protein is not working correctly, it's unable to help move chloride, a component of salt, to the cell surface. And without this chloride, to attack water to the cell surface. The mucus is very thicky, and it cannot be produced out. After that obstruction, after that infection, after that progression, after that bronchiectasis, and after that losing and respiratory failure. It is the worst time. During this last century, from 1938, when was the first pathological description, this treatment becomes still better and better, especially after this 80s years when CF protein was identified and CF gene was identified. Very nice was time when we start with newborn screening, because we can catch this patient from the beginning, and it is really becomes better results for treatment, and for these children started to come to the regular checkup, and we have now patient, for example, 7 years or 8 years old, and these children was never in the hospital. They have never pseudomonas. They came to our ambulance for checkup every 3 or 4 months, and they are really, really very nice. And even they receive less therapy and less antibiotics than all other children, for example, in the school. Because we take care in every checkup. We do throat swab. We speak with these parents, and if they are very comfortable and if they are very nice, their children are really more healthy than other children, because they know what it is. Only sometimes we have a little bit problem. They are sometimes overprotected, and we want children to live normal life. We don't want them to stay at home. We want them to go to the school. We want them to go to do sport, anything what they want, as other children. I know. I think you know this feeling better than me, because I'm only speaking about it. And especially, we have now very nice time after 2022, when these CFTR modulators came. Sorry. It means here. This slide is only for the reason that we have more than 2,000 CFTR variants. It means we have still no treatment for every children with cystic fibrosis, because there is minimum a few moment. We have 5-6 classes of CFTR variants, and for these classes we have potentiators, and for these classes, during this CFTR protein becomes, we have here correctors. It's a question for which variants we have treatment now. If you want to look for something, there is very nice page on this screen, CFTR2 variant search. When you see these results, delta F02, 08, and delta F08. These variants, drugs combination, lumacaftor, ivacaftor, Orkambi, and also Simdeco, Simkevi, and also Trikafta has been have been improved in some countries for individuals with this variant. And you see this variant combination cause cystic fibrosis and cause pancreatic insufficiency. And when you put your variant into this CFTR variant research, you will see if your variant is for some treatment or not. It's for doctors. And also, when you are not sure that if this variant causes cystic fibrosis, also you can put this variant into this page. I want to show some other variant. This variant is not so clear as the last one. You have this information. You have this information for CFTR modulators, Calideco. There is also for Simdeco and Synkevi, also for Trikafta and Kaftrio, have been improved in some country for individuals with this variant. It doesn't mean that it is also in Slovakia, it doesn't mean that it's also in Ukraine, but it means that it can be for this variant. Because there are clinical studies that it helps. And you have something in your hand when you want to ask for such treatment. But also you have here this information. This variant combination has varying consequences. Some patients with this variant combination have cystic fibrosis, and other patients with this variant combination do not have cystic fibrosis. And also, because of this variability, it's very important that clinical criteria alone be used to determine whether a person with cystic fibrosis has cystic fibrosis. It means I have, for example, a patient with this variant, and his pancreatic sufficiency, he looks very nice, and he has no bronchiectasis, he has no severe, or he has no some infection, respiratory infection, and for that I didn't ask for this, I offer this treatment to the parents, but they didn't want, because they feel he is healthy. Yes? This slide is maybe not slide what you expected to see, but there is effect of CFTR modulators on manifestation of cystic fibrosis in main organs and symptoms. What is plus? This is potentially beneficial effects. This one is not so clear, for example. Chronic bacterial infection, CFTR modulators, yes, it is. We know that result is that respiratory failure is less, and these children, this patient will be better. For liver disease, we are not sure. Here is question. For pancreas, we know, yes, for most patients, they are better. They have less pancreatic insufficiency, but when we check the result for pancreatic elastase, it's the same. It's the same. They feel better. They have better stool. They have more power, but the results for pancreas, for enzyme, for pancreatic elastase is the same, or a little bit move, but not too much. They still stay pancreatic insufficiency. For male infertility, it's plus minus. For chronic sinusitis, it's better. For abnormal cevitus, it's better. For intestine, some is better, some is still question. For example, risk of colorectal cancer. And for bones, we still don't know if it will be better with osteoporosis or not, because it's a long time to see. It's a question. CFTR modulators are very nice. Treatment, but we have to take care because it has special warning and precaution for use. There is some contraindication. We know that it's becomes elevated transaminase and hepatic injury, hepatic impairment. As a side effect can be depression, renal impairment, and other. I want to say we see only one side effect of CFTR modulators, and it was cataracta. It is very rare, and I ask what we can do for it. We should stop for a while, and after that becomes again better. When we start with Karideko-Kaftrio and Orkambi, we have a protocol what to do and how to check and how often, how frequently we check something. Before Karideko-Kaftrio, you have the same, I think, ophthalmology, biochemistry, and other examination. And every 3 months, we check transaminase, we check pulmonary function test, and we check clinical status. And for us, because we want to have some result for insurance company, for health insurance company, it means some economical. If somebody asks how it works, we check also chloride test after 3 months. And of course, pulmonary function test. We want to know, and other doctors also has to know what means CFTR modulators, especially with combination for some treatment, some treatment, some therapy. Doesn't have any effect on CFTR modulators. Some of them, yes, at increased side effect. Especially what we use, for example, can be rifampicin as antibiotics, phenobarbital, carbamazepine, phenytoin, it is for neurological treatment, but also ketoconazole, some antimycotic, itraconazole, posaconazole, it's all voriconazole, it's antibiotic, and you see also clarithromycin. Azithromycin is no problem, but clarithromycin is Clacid or Fromilid or I don't know its name for here for this country. It must be changed this doses for treatment. Here in this slide is only side effect associated with CFTR modulator. As I said, I saw only this one cataracta, but we have in Slovakia one side effect, very bad liver failure, which goes even for transplantation. But it's strange, and nobody knows why it is. We check every time this liver test, and even it was not a patient which has higher liver enzyme before treatment. Yes, but we take care, and we spoke with Ludmila how it is important to take care about liver, because maybe 30%, for example, in our country, and I think also in Ukraine, has hepatopathy or liver disease connected to cystic fibrosis. How it is in Slovakia? We have Ivacaftor since 4 months, but we have no patient, or I have no patient with this CFTR variant. We have Lomacaftor, Ivacaftor, which is Orkambi from the age of 2 years, and we have We have SIMK and SIMDECO from 6 years, and we have Elaxacaftor, Tezacaftor, Ivacaftor. It means Trikafta. I will speak this name, but only for delta and delta with mutation, with variants with minimal function from the age of 2 years, from the age of 12 years. I was thinking about these 2 years because now as I know, Emma started to negotiate this Trikafta from 2 years of age, and in European Union is already approved Trikafta from the age of 6 years, but we have not know this treatment from 6 years of age until now. We hope that we will have, and our patients are waiting for that. I will want to show you one our patient. He was not very nice patient, I want to say. He was Eric, and he was from a little bit difficult family. This family doesn't take too much care about this his son. Even he has only one brother. He was healthy. No any family history. From personal history, as normal children, perinatal anamnesis was okay. It was a little bit icterus. After that, repeated cough, bronchitis, lower respiratory tract infection, bronchopneumonia since the birth, and he has no good stool. At the age of 6 months, it was before screening. At the age of 6 months, because of this repeated respiratory tract infection, was sweat test done, and it was positive, as you see, 126. Also, stool was positive. It was also steatofibrosis and typical chronic sinusitis, polyps, and everything, all this with cystic fibrosis. At the age of 6 years, after that operation for polyps, and genetically it was homozygous delta 508. Infection, Staphylococcus, Pseudomonas, IV treatment, Serratia. At the age of 15 years, oxygen, home oxygen therapy. At the age of 16, he was placed on the waiting list for a lung transplant because really he was very bad and it was very severe bronchiectasis. But at the age of 17, it was a few months before other children receive this new treatment. We asked for him because we know we are expecting to come this Trikafta, but a few months early we asked him for him special this Trikafta, and he started to have this Trikafta. Improvement during 3 months it was 14%. He was not. He doesn't need any more oxygen. He feels good. He was really very very nice. It was plus 4 or 5 kilo, and after that he came to my ambulance and he asked me, "Can I go to Holland? I want to go to work in Holland because I feel very 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 well, and I'm 16 years old, and I want to." And I said, "Okay. I don't know, would be better to stay here and not to start to work too much physically because this bronchiectasis will not disappear. It will be better, but you still need a treatment. You have to do inhalation. You have to take creon. You have to take care about yourself. You have to do physiotherapy. You feel better, and I hope it will be better for many years. But what was destroyed, it will not become new." Yes. Now, after this 3 months treatment, we do this statistic We have improvement of lung function. 2 patients finished oxygen therapy. It was improved, you know, it was improved. So, I will speak only. It was improved pulmonary function test. It was improved pulmonary function test plus, you know, I want to see, plus 13%. It was vital capacity, FEV1, it was 15%. Sweat test was decreased 44%. And we reduced also pulmonary exacerbation. We don't have maybe 2 or 3 patients in a year was now hospitalized for infection, for pulmonary exacerbation. Not more, and or maybe not for a pulmonary exacerbation, but we still hospitalize this patient for IV antibiotics. Because if they have Pseudomonas aeruginosa, some of them, I don't want to say that they don't have a Pseudomonas aeruginosa, but we are not able to prove. It's not the same. We don't know still, because they stop to cough, they stop to produce sputum. It means we do only throat swab and nasal swab, and we don't know. It need not to be the same as microbiology from lower part of bronchi. Yes, it means we are not sure. It means when they are a little bit worse, we hospitalize them. And you know, it's very nice. It's a age of patient in HCFS organization, which is in the registry. How it is, how we expected more than 50 years. Better for male than female. It's strange, but it is like this is male and this is female, because in normal population in our country, 5.7 years live female more than male. I wrote statistic last week. I think it in Ukraine will be maybe more because of this last situation. Yes. It is new treatment, not only CFTR modulator, but other one we are still expecting also new. And at the end, this is a Košice. For people who doesn't know, this is theater, this is our marathon, this is our fountain, this is our church, and it's a new part of Košice and night Košice. Thank you for.
Anna,
Your experience is really impressive, and we hope that we can take into account some of the details just presented so that we can understand what our specifics is and what we can expect in the future. We're going to have slight changes on our agenda. And I would like to introduce a physician who is not just a physician, but who is a doctor who is a friend for our patients, for colleagues. This person expressed great support to us when the war broke out. It's a person who is willing to take risks and who is not afraid of taking risks. This is somebody who can stand the ground supporting the opinion of the patient, regardless of what the people outside or around them are thinking. This person doesn't really pay much attention to their own life, but they dedicate the majority of their time to science and to our patients, and not just in Lviv region. And on behalf of all the parents, I would like to thank you. And I'm talking about Ludmila Bobar, who is the head of the Pediatric Center for Cystic Fibrosis in Lviv. Good afternoon, everyone. Larissa, I'm really touched. I'm about to break into tears. We are working together. It's the work of the entire team. And what I'd like for you to see in the presentation, can we put it on the screen, please? So what I'm going to be presenting is the result of teamwork. So in cystic fibrosis, it's impossible to work as a separate physician. So it will never work. A cystic fibrosis program will never work if there is no cystic fibrosis center, if we don't have the experience of doctors who've been working with multiple patients, if we don't have the results of the analysis of their work. My presentation will be dedicated to new opportunities that Ukrainian patients are having. We'll also be speaking about the support that the entire world has provided to us, the support that they've provided to our children to make the quality of their life better. And at the beginning, I would like to express my gratitude to all the colleagues, to all the donors and well-wishers who have made everything possible. And today I will be talking about the results of the start of using modulators. I want to express my gratitude at the very beginning because then I will proceed to the slides and the information that I wanted to present, and I may be lacking time. That is why I think that we need to express gratitudes at the beginning. So what are the modulators of chloride channels? And Anna indeed helped me a lot. And I'm impressed that we met many years ago in Muzhgorod. We've been working closely together, and I'm really grateful for your support to my patients who are staying in Slovakia. And I'm expressing my gratitude to you for sharing your experience, for always being willing to answer all of my questions. So you just told the entire audience everything about the modulators, and my topic is really similar, so I don't really know what I can add here. So maybe I could just summarize it in simple terms so that our parents can have a better understanding. So what are correctors and potentiators of chloride channels? These are groups of molecules that have an impact on the function of chloride channel. And this function is performed by a protein that is coded by a CFTR gene. And as a result, we have a mutation of CFTR gene. And as a result, we have a depletion in the quality or decrease of the function. Thus, the chloride channel doesn't work properly, and we have clinical manifestations of cystic fibrosis. If we have impact on this protein, we will be able to have impact on the clinical manifestations of cystic fibrosis. Correctors increase the amount of protein on the surface of the cell, while potentiators, they have this opening in the wall so that the increased number of protein cells that we have on the surface, on the membrane, could function properly. And as a result, it appears that the best therapy is combined therapy, where we have correctors and potentiators in one medication. And we have the opportunity of working with triple therapy, and I'm really happy about it. To be honest, I'm really euphoric. My patients are euphoric. I understand that as we start using this therapy as the therapy unravels, maybe we will not be as euphoric, but at the moment we are really very happy and pleased. If we increase the quality and improve the function of chloride channel, the modulators will decrease the clinical manifestations. So that's something that we are observing. We don't have that many exacerbations. The lung function is improved. The sweat cell number is decreased, and in general the well-being of our patients is improved. At the same time, the role of infection in the life of the patient is decreased, and that's something that Anna talked at length about. And she presented some clinical cases in her presentation. So we have decreased manifestations of pancreatic failure, and if we are talking about diabetes, then the doses will be either decreased or we don't even need to use insulin at all. And there are some records in papers that the intake of modulators in the third trimester for a pregnant woman can prevent having a gene modulations in women. We also need to talk about exacerbations. That's again a topic that has been extensively covered by Anna, and I tried to summarize all the potential exacerbations. These are changes in skin, distortions of liver function, cataracts, depression, and we also need to talk about people with diabetes. They need to watch glycemia levels, because as a result we may have hypoglycemia, which is a really complicated condition, and a person may need to spend some time at the intensive care unit. And our colleagues abroad are also highlighting important aspects. We are currently experiencing euphoria, and they are already observing the patients who have been taking Trikafta for a number of years, and the complications may be delayed. And here we are talking about the factors affecting the function of cardiovascular system as well as obesity. I think that every mother present in this room whose kid has already been taking chloride channels modulators has been urged to go to the gym. So parents are informed that their kids need to go to the gym, that their diet must be healthy. And in Ukraine, we already have the modulators. In order for us to get the modulators, we've completed all the necessary legal steps. And Larissa mentioned the date, the 31st of March of 2023, a landmark date for our Cystic Fibrosis Association. And in 2.5 months, we got the license from the Ministry of Health. Then in August, the first shipment arrived in Ukraine, and then in September, the supporting documents were approved. It took a lot of time and effort. We needed to create the protocol of monitoring, the protocol of toxicity and questionnaires, and right now we are collecting data. The local protocol, we need to inform them about the importance of monitoring of essential functions, and that is something that Anna also told us about. They need to sign an informed consent. A questionnaire must be filled out either by the patient themselves or together with their parents. So we analyze the data received. We need to make sure that there are no contraindications, and then the person may receive the medicine. So this is a sample of a protocol that has been shared with us by Dr. Poplavska, another great friend of ours, who's been sharing their experience of using this medicine with us. And we really liked this example of the protocol, this template. So we have 3 visits which we are conducting with higher frequency. We are doing that just to check whether there are no exacerbations. So the initial exacerbations help us to correct or adjust the dose. So we have the 0 visit, which allows for us to see whether we can even prescribe the medicine. During the first visit, we monitor manifestations of toxicity, and during the second visit, we are proceeding to the stage when we are conducting these monitoring visits every 3 months. Of course, because we have the war, it may be difficult to implement, but we can have meetings over Zoom together with Larissa. We are keeping in touch to make it possible for our patients to feel as comfortable as possible. So currently, 57 children at our center get this medicine. Patients are from Lviv region and other regions of Ukraine. 30% of patients come from other regions of Ukraine, actually, and the duration of taking of this therapy is between a month and 3. So this is not a lengthy duration. We are just trying to accumulate data at this point. So our initial feedback, what we've been observing, increase of body mass between 1 and 5 kilos. This is the positive dynamics, which is really impressive. Increased pulmonary function. So it's easier for children to cough. The obstruction is not that severe. Of course, it doesn't happen for children with pulmonary fibrosis. Tricharta does not treat that. Tricharta just treats the obstruction. So we have decreased frequency of the cough, we have decreased mucus viscosity, and the most important thing is that children started having a good night's sleep because they're not coughing at night. And I think that every parent will agree with me that this is really important. There is no bloating. The children are happy. They're active. They come to my office telling me, I can breathe. I want to walk. And I have the strength for that. They have the vitality necessary, which previously were quite limited. They stop sweating, and the parents will probably agree with me that very often their children may have sweaty palms, there may be an odor coming out of their body, and having less of that is a significant improvement of the quality of life. And I haven't noticed any signs that would tell us about potential depression, at least at this stage. All our kids are examined by a psychologist, and they receive consultations from a psychologist. They are monitoring anxiety levels and risks of depression. At this stage, we have not had patients like that, but we may potentially have them in the future. With regards to side effects, we've had some stomach ache and diarrhea, headache for those with chronic sinusitis. A kid who used to be really emotional became even more emotional. If we're talking about changes in the skin, that was just one patient with liver cirrhosis. Hepatobiliary indicators, there were no significant changes that would tell us about change of treatment, then depression, sleep disorders, and ophthalmological symptoms. But again, I need to highlight that the duration of the course of treatment is just 3 months. And thus I'm urging all the parents to have a look at this slide. All children with cystic fibrosis who were given Trikafta require effective physiotherapy. At the beginning, you will have more sputum, more mucus, because it becomes more liquid and you need somehow to extract it from the body. And this is where you need to use your skills and experience, something that you've learned from our physiotherapists. Our physiotherapists use combined methodology, they use different regimes for the use of this methodology. Additionally, they train the parents. And they use different equipment, and for that I want to thank our Slovak colleagues. This is really important in our work. To prevent obesity, we are urging everybody to do more exercise than they used to do before taking the medication. And of course, it's necessary to follow the right diet. So right now, let's not talk about the euphoric stage anymore. Let's discuss some challenges. We've been facing some challenges because the load on the staff members and our colleagues from the center has been doubled or tripled, but what we are seeing is that we can work together efficiently, and we are capable of that. I'm really grateful to our physiotherapists, nurses, and staff members of different labs. I'm also grateful to psychologists, nutritionists, and ophthalmologists for really professional work. And here you see a not exhaustive list of all those involved in the project at the moment. I'm really grateful to my colleagues. Olga, Marta, thank you for joining this project. Without you, it would not be possible because it's a really heavy workload. And I'm really grateful to the management of the hospital because with their support, we were able to introduce this treatment and do it within the legal dimension. So we have already submitted the application for patients from other regions to receive this treatment. We have compiled this application for 300 patients. And what does one need to do to become part of the project? We need to have a really close cooperation with attending doctors of the patients. Of course, we need to measure the levels of sweat chlorides. We need to have a DNA test. We need to have the medical record and justification for diagnosis. This will make our life and work easier. We also need to have blood chemistry tests, something that we will be monitoring and something that will become the foundation for our work. And we will also be informing all the attending doctors about the dynamics of the disease in the future. It's really important to have correct triage of the patients, and Anna has paid a lot of attention to infection control. So we don't want for our patient to contract any new infectious disease at our hospital. A new infectious disease is a new treatment protocol. We don't want for the patient to get any additional infectious diseases. Thus, we need to have information about infection factors for each particular patient. So we need to have the schedule for doctor's appointments for patients with different pathologies of infections. Patients must show up at the doctor's at a specifically scheduled time, and patients with diagnosed exacerbations will be treated either at our center or at their place of residence using our recommendations. We will not be able to treat all the patients, but nonetheless, it's possible to discuss options. A close contact with the attending doctor of the patient is really important. It's important that children are vaccinated. All our patients have received vaccines against influenza. I cannot speak positively for COVID, but at least the first doses were administered to our patients. We also need to have information about regular and recommended vaccinations. Unfortunately, many patients with cystic fibrosis are not vaccinated at all because they are considered to be patients with a severe condition, and that's why there are contraindications against vaccinations. I really love this slide because it demonstrates the entire history of cystic fibrosis. It tells us about the importance of links between science and clinicians, and we see how one success story overlaps with another, and it amounts to a pyramid of success. So no success has been neglected. So diagnostic organizational criteria. So here we are talking about diagnostics of cystic fibrosis and treatments. They all add on top of each other. So nothing in cystic fibrosis has been left out. So we keep the treatment protocol that has been developed. Of course, it's updated with time. It's changed because life changes. And treatment is no longer such a huge challenge as it used to be in the past, but it remains a challenge. We have always had it in the past, and you've heard it from Professor Toft and from Anna, that the duration and quality of life depends on the condition of the bronchopulmonary system. We have taught you. If we haven't done it yet, we will teach you how to take care of this system. But you need to hear your doctor, and you need to be eager to learn. The foundation of the quality of life has always been adequate correction of pancreatic failure. Of course, it decreases with the use of chloride channel modulators, but it never goes away. It never disappears. So you need to have adequate correction against the background of a healthy diet, and maybe you need to consult a nutritionist if you find it hard to come up with a healthy diet. All this will result in a better life quality for a patient, and a patient who feels strong enough can engage in physiotherapy. Creon has been and will remain the medication that will allow for adequate correction of genetically determined pancreatic failure. And there's one more slide which is similar, but what does it tell us? That there is no magic pill for the treatment of cystic fibrosis. Every year, every decade, we improve the efficiency of the treatment and we improve the treatment quality. But at the moment, there is no magic pill. Nobody has invented it as yet. We are just moving in this direction. What is efficient is an individually prescribed comprehensive therapy. So every patient needs to have their individual treatment protocol. And in treatment of cystic fibrosis, I need to highlight that nothing is taken out, we just add new things. Treatment of cystic fibrosis requires for teamwork, and here you can see an example of that. This is our meeting in Dnipro back in 2016 when we were exchanging experience with our colleagues, and it was a cooperation between the European Association and our colleagues from France, from Poland. Thank you very much for your attention. I think that when you hear us, when you share all your problems with us, together as one team, we will be able to help you solve your problems. Thank you. Thank you, Ludmila. As I've mentioned before the beginning of your speech, everybody in Ukraine is really grateful for that work that you are doing, and I want to join in some of the words that you've mentioned. So you mentioned your team members who are helping you, and we were able to witness that. We are the first-hand witnesses of that. I would like to express my gratitude to Olga. I'm expressing my gratitude to Marta, to Svetlana, to Mariana, I'm sorry. Perhaps I forgot someone, but I want to thank all the doctors who are working with our patients. Of course, I'm grateful to Helena Makuch, but we will discuss that later. Thank you. Thank you. I wish you inspiration, and we are always by your side. Thank you. And right now, we are going to hear a speech by a German professor, a doctor with many years of experience, who has dedicated his time and life to helping patients with cystic fibrosis in Germany. And I'm more than sure that he's been treating some of his patients that are from Ukraine, and I'm inviting Professor Carsten Schwartz to deliver his speech on the selection of antibacterial medications for treating pulmonary infection in patients with cystic fibrosis during targeted modular therapy. Professor Schwartz, you're welcome.
I hope you can hear the translation.
Yes, of course.
So I will talk about the approaches of inhaled antibiotics when patients are receiving target therapy. It's a pleasure for me to speak to you in these really still very sad times you are confronted with, and also for us. But I'm very happy that you invited me, and that we can support you over there in the Ukraine, and support you also in scientific approaches, and that's why I'm very happy to be here today and to talk to you. These are my disclosures. And when we look at the pyramids of people with CF, we can see that there's a huge change between the time 20 years ago and right now. You can see the green bars, which were the case 20 years ago, and now you can see that female and male people with CF are getting older and older. So that is really already before we had modulator therapy, so causative therapy, a very good approach by the entire CF team. So the CF team, not only the doctors, but the nurses, dietitian, physiotherapists, and so on, they achieved these goals that we can see here. And this is from the States. You can see every year we almost see an increase in life expectancy in our patients. And also again, if we look at the FEV1 as a lung function between 1990, 2000, 2010, and 2020, we can see that there is a bigger part, in particular for the patients who have a good lung function. So this was also before the era of causative therapy. So there was already a lot done in the last decades, but right now we are really confronted with a totally new and better possibility than ever, I have to say. But we also are confronted still with a drop in pulmonary function test. You can see the males and females in blue and purple, and also the gray lines, that more or less in between 20 and 30 years, there is a decrease of pulmonary function. Usually it starts after the puberty. Young people, they are not very eager to do the therapy, neither inhalation nor any tablets. So that's why we usually have this drop in FEV1, but still we see that we are not able to heal the CF. So there is still a lot to do. And why this is the case, you can see here. The lung, which is the primary focus in cystic fibrosis, because it's in over 90% is the reason why people with CF might die, are the infections that are still causing a lot of damage in the lung. And in particular, in the younger age, it's Staph aureus, the blue line, but the older the patient gets, the more likely it is that he will be colonized by Pseudomonas aeruginosa. That you can see here, the lines are crossing at the age between 30 and 40, and then usually more patients are colonized and infected by Pseudomonas. If we now compare the different age groups where people were born and received therapy, we can divide it into three different people with CF: the group of 2000, the group of 2010, and the group of 2020. And you can see that the youngest group, they will have a lower number of Pseudomonas colonization, but the older they get, the closer the lines will become. So at the age of 50, almost the same results are seen. So there is still a high frequency of Pseudomonas positive patients in CF, also right now with the new therapy. So what we always were confronted with in most people at an older age was the vicious cycle that you can see here. Patients will have inflammation, mucus production, airway obstruction, lung damage, infection, and then it's beginning again with inflammation. So this vicious cycle is now almost destroyed or blocked or influenced by the new therapy with elexacaftor, tezacaftor, and ivacaftor, or also with the other modulator therapy like lumacaftor, ivacaftor, or tezacaftor, ivacaftor. So that was influencing really the vicious cycle, which is very important when we now talk about therapy that is still needed, like inhaled antibiotics. Because it might be stopped that they have no mucus anymore, and so they are feeling better. That's totally true, and it has really changed, but we still see a lot of inflammation that is caused if the Pseudomonas is still there. We know that, for example, from patients with non-CF bronchiectasis, they have a Pseudomonas, but there we don't have inhaled antibiotics, and they will have some tissue damage over the time if they are not treated with antibiotics, in particular with inhaled antibiotics. So the question is right now, is there still a place for inhaled therapy in the era of CFTR modulator therapy? We have DNAs, we have inhaled antibiotics, bronchodilators, mannitol, hypertonic saline. When we look in our registry data in younger people, we can see that there are still a number of patients receiving DNAs, also very low as mannitol, and children usually it's not intended, but for hypertonic saline, we see that almost 90%, and at least one of these three drugs is given in 93%, so really high. Then we have the short and long-acting beta-mimetics. Short-acting usually is also very common in younger people, and anti-cholinergics and anti-staphylococcal therapy is more or less rare. It's not done anymore so often. So in adults, you see that there's a lower number using DNAs. Mannitol is 6%, is also low, but hypertonic saline in 75% of the patients is prescribed, and at least one of those therapies is an almost 90% prescribed. Long-acting beta mimetics are much more often in adult patients, so it's more than 60%. and anticholinergics are in 50% prescribed. Then if we come to the modulator therapy now, these data are not the data from this year, so it's an older data, but there already we can see that 60%, but right now it's almost 80% are receiving causative therapy with CFTR modulator therapy. And in the line below, you can see in patients with chronic Pseudomonas infection, still 90% were inhaling these antibiotics. And if we are talking about Pseudomonas, we have to talk about the different antibiotics we have. For acute and severe infection, we can use intravenous antibiotics or oral antibiotics, but usually it's on the ward with intravenous antibiotics. But for the suppression therapy of those patients, we need to use inhaled antibiotics. And why is it so useful to use the inhaled antibiotics? It is because we have a local treatment compared to systemic treatment in our patients. And so if we have a systemic treatment, we usually have also systemic side effects. And as we have a lung infection, we want to have a high amount of antibiotics in our lungs and not in the entire body. So that's a huge benefit. And one of the most important things for me is already a study that was run more than 10 years ago. So in the States, they looked at patients that were receiving tobramycin or not, and they compared the mortality over 10 years. So after 2 years, 5 and 10 years, you can see that the group with tobramycin had a lower mortality than the other group. So you can see that not only during the study, the pulmonary function test, for example, after 3 months is increasing, but much more important, the survival is really influenced, and that is really a very important issue we have to notice. A little bit about the history. So we can see that it started all with more or less aminoglycosides, so with tobramycin, then colistin, and then it was new in 2009 with atronam, the third inhaled antibiotic. So there was a different proportion of the inhaled antibiotics. And right now we have 4 different inhaled antibiotics available, at least in Germany. So it's aminoglycosides, colistin, atronam, and levofloxacin. And there's a very nice review about all 4 different inhaled antibiotics, where you can say that in terms of FEV1, they're really comparable. So all the 4 drugs are very good for treating Pseudomonas as a suppression therapy and have a very good effect against Pseudomonas. So now the question is, as we have a lot of data and now a totally new landscape in cystic fibrosis, do we still need inhaled antibiotics for our patients receiving a really good modulator therapy? Yeah, again, let's have a look at the registry in North America and also in Germany. We see there's a peak in the States with 55% positive for Pseudomonas, and in Germany for 73. So there is still a big proportion with Pseudomonas. Therefore, we know already it is really important to have these antibiotics. But what we also see, we know that the modulator therapy is influencing not only the stability of the patient, but also is influencing the exacerbation rate. And I just mentioned at the beginning that we have not this vicious cycle anymore with the mucus, but maybe other issues regarding the exacerbation. But here in the registry, you can see that there are at least 20% having 1 or more pulmonary exacerbation, and 2 and more around 5 to 10%. So it's 15 to 20, maybe even 25% in total that will have still a very important exacerbation that has to be treated. I only now want to show you some slides in terms of our study that we were running at our CF center with levofloxacin, because we wanted to know if we are adding a new inhaled antibiotic, if we can influence something in our patients that are now more stable than before. So we were looking at 360 patients with CF in 2016, so that's already a little bit ago. We had 1/3 pediatric and 2/3 adult patients. and 108 received levofloxacin therapy. So we had our data registry system where we looked into the data, and every contact to our patient is documented in our so-called Muco web app. Then in these 108 patients, we could include 86 patients that we had to look closer and could study levofloxacin in these patients. The median age was 34 years, the gender was 54 for female, and the mean BMI was 20.2. And the mean FEV1 before the start of therapy at day 0 was 44% predicted. So what did they inhale before they started levofloxacin? The biggest group was colistin, second biggest was aztreonam, and then the third was tobramycin, as you can see here on this slide. So what was the reason for changing the inhaled antibiotic? That is always a very important question if we run a study with inhaled antibiotics. So one of the most important points is usually that there's an intolerance or a side effect of the previous antibiotic. Then the second is no clinical response to the previous antibiotic, and then also an interaction with inhaled tobramycin and oral azithromycin. We usually try to prevent the prescription of inhaled tobramycin and oral azithromycin because there might be antagonistic effects. Then also if the patient is stable, it might be good, but maybe it could be better. That's why we always want to improve the lung function. That can also be a reason for change of inhaled antibiotics. And if there is an increase of exacerbation rate. So here you can just see every single patient from day 0 to day 28. You can see that it is significant. And what was it like? So there was an increase of FEV1 in those patients that were really stable, so that we could see that already after 4 weeks, it is a positive effect in terms of the FEV1. I mean, the BMI sure is stable. There should not be a change. But really striking was to see that there's an influence almost not on Pseudomonas, on the eradication. So we can see now the blue bar with the start, the orange after 4 weeks, and then after 1 year is a gray one. And it was really interesting to see that for the Staphylococcus aureus with levofloxacin, there was a drop in colonization with Staph aureus from 37 to 26, which was not expected. And the other bacteria that we detected were more or less stable. And the second point that is always important in studying the inhaled antibiotics that I mentioned before is the exacerbation rate. You can see the red ones, they are more higher than the blue ones before and after. And the results after 12 months compared to the 12 months before the study start was 3.2 exacerbations in the year before starting levofloxacin, and the 12 months after or with levofloxacin was 2.7, which was also highly significant. So there was a positive effect in the FEV1 measurement and also in the exacerbation rate. And if we are talking about activity of a drug, we also have to talk about side effects. So there were only single side effects reported in the study. 5 patients suffered from tendinitis or pain in the Achilles tendon. That is mentioned already in some cases for quinolones, but it has no huge influence in this study population. 2 patients discontinued for a while the therapy due to dysgeusia and emesis, but could start again. And none of the patients, and that is really amazing, had chest tightness or bronchial obstruction. We know that usually that for all inhaled antibiotics, it is known that they can cause a 5 to 10% bronchial obstruction. But with levofloxacin, it was different in this group, which was really amazing. Yeah, there's always a question about susceptibility testing and resistant. If we had treated resistant or susceptible patients, as you know, usually you can't use the susceptibility testing in CF patients. I will show you one slide later why. But here there was no significant change before or with the therapy. So there was no change in 49 patients, and in 7 it was changed from resistant to sensitive. and in 7 it was changed from sensitive to resistant. So the conclusion is that levofloxacin was well tolerated and had a positive and significant change in FEV1, and there was also less bronchopulmonary exacerbations compared to the time before starting levofloxacin. And as aforementioned, I wanted to just show you in this one slide to explain why we can't use the susceptibility testing for Pseudomonas in cystic fibrosis. I mean, we usually would always use these tests to be guided which antibiotic we should take. For example, if I would have a pneumonia, please use the susceptibility testing. But in CF, in the lung, the pH, the environment is totally different. And also, we have not only 1, but maybe 3, 4, or 5 different Pseudomonas in the lungs, which might influence the susceptibility testing. And here are 3 main publications. The first one looked at the influence in terms of FEV1, if they were susceptible, partially susceptible, or fully susceptible, and there was no clinical significance between the therapies. The second one, in Chest Journal published, compared the minimal inhibition concentration, because they thought, okay, that's more direct and maybe there's a difference. But for tobramycin, also not for ceftazidime, there was no clinical significance. And the last study, published in Lancet, they looked at a huge proportion and had a double testing. So they used 2 antibiotics as it's usually used and tried to see if there's any influence. But also in this huge study over more than 4 years, there was no statistical significance. So we know that we can't use it. And if we are talking about inhaled antibiotics, we also know that we have 100% higher concentration in the lung with the inhaled drug compared to a systemic treatment, which overcomes the minimal inhibition concentration. So therefore, in inhaled antibiotics, it's also not that important. So to conclude, for levofloxacin, very well tolerated, reduction for single bacteria, in particular for Staph aureus, increased FEV1 and decreased exacerbation rate. So now, how should inhaled therapy be implemented into daily routine if we have patients who are now treated with modulator therapy? So the first is we have a Pseudomonas positive patient, and those should get inhaled antibiotics. But what is with the other inhalation? So if the patient is responding to CFTR modulators, we would recommend to reduce the inhaled therapy step by step. Don't stop everything. Stop the first drug, wait a bit, like 4 weeks, stop the second drug, wait 4 weeks, and control the patient, and so on. So that is recommended. So if the patient is not really well responding to the CFTR modulator, they should continue the inhaled therapy, and that's what also our patients would do. And I want to give you some examples why it's so important to look at the patients a bit closer. So here you can see the FEV1 on the left side, the blue line, where ETI was started. It was a very good increase in FEV1, and then suddenly you see with every visit there was a decrease in pulmonary function test. So what happened? So the patient, as you can see here, stopped the bronchodilators, and you see the pulmonary function test dropped already 15%. So this is really significant, and only by stopping the bronchodilators. So the next patient, it's a female patient, also Pseudomonas positive. Again, she started with ETI, a very good response, so an increase up to 90%, FEV1% predicted. And what happened there? Again, there's a decrease in pulmonary function test in FEV1. And this patient, she stopped the inhaled antibiotics. So you can see also with the inhaled antibiotics, you are influencing the pulmonary function test. And also here you can see that the patient is still very much above the starting point where she felt unwell, and now she's still feeling much better than before. So there was also no activity to change anything back to the inhaled antibiotics. But as we looked at the pulmonary function test, we were wondering, wow, something happened, so we have to continue it again and start it again. And if we're talking a Pseudomonas, we also have to talk about the tip of the iceberg. So it's not only Pseudomonas that is causing damage, but in particular in adult patients, we have much more to focus at. So it's not Pseudomonas only, but Acronobacter, Stenotrophomonas, and so on. And this is important if we are thinking about our inhalation therapy. So if people are colonized with different bacteria, we could think about which might be the best inhaled antibiotic for those patients. So they are all approved for Pseudomonas, so that's, I think, no doubt, everyone is good to use at that patient. But if you look at Acronobacter, Steno, Staph aureus, and even MRSA, we see that there are some patients who would benefit for Acronobacter with colistin and also levofloxacin in addition to Pseudomonas, and the same is for tobramycin and levofloxacin in terms of Steno. And Staph aureus usually is very good treatable by levofloxacin, and MRSA usually only with levofloxacin. So that might really influence the choice of my inhaled antibiotic. And usually patients are not stopping their treatment anymore for 4 weeks, so they have an on-on therapy. So they would change every 4 weeks to antibiotics. And if we have 4, the question is always which should we combine with? And the mode of action gives us an answer. So Atrona and colistin, they destroy the bacterial cell wall synthesis or the bacterial cell membrane. So one of these drugs should be combined either with tobramycin or with levofloxacin. That should be, in terms of the mode of action, be one of the choices. So now I want to come back because we saw the drop in exacerbations. Now we have already more than 4 years of experience with modulator therapy. We see that people might have an exacerbation and neither the patient nor the doctor will realize that they have exacerbation. And the reason is that if you look at the criteria that are shown here for an exacerbation, change in sputum volume and color, usually the patients have no sputum anymore. Increased cough, they usually have not cough anymore. Fatigue, malaise, they are feeling so much better. And weight loss, they have a lot of gain and they gained a lot of weight. This is also usually no issue. The decrease in pulmonary function, yeah, that's something we can see. Radiographic changes, usually we are not doing it during an exacerbation, and increased dyspnea usually is also not seen anymore. So most of those points are not currently existing anymore. So we have to think about new biomarkers. New biomarkers are needed to see if patients have an exacerbation. And this is really important because the patient feels so much better and they are totally tired of getting antibiotics. But we need to maybe check more, for example, not only pulmonary function tests, but maybe LCI or using blood markers to see if the patient is having an infection. And that is really important then to treat. Otherwise, we will have damage of the lung tissue again. At that point, I want to sum up my talk. There's still a place of inhaled therapy also during the modulator therapy era. I think stopping bronchodilators might decrease FEV1. We saw this in this one case, and also stopping inhaled antibiotics might also decrease FEV1 and increase bronchial exacerbations. No change in patients not responding to CFTR or not available for CFTR modulator. They should just continue the inhalation. And inhaled levofloxacin is well tolerated and can increase FEV1 and decrease bronchial exacerbations and also influence bacteria growth. At that point, I thank you for your attention. This is our CF center where I'm just sitting right now. And this is Potsdam with the Schloss Sanssouci Castle and the team doing a charity run. Thank you very much for your attention.
Thanks a lot, Professor, for your perfect presentation, which really is highly informative. And thank you for giving us an opportunity to learn some lessons and take some knowledge as the basis for our future work. And now I'm going to introduce to you, since we have some changes in our agenda. So now we will listen to the speech by our best friend, a person who has got a very good and kind heart. A lot has been done in Ukraine thanks to this person, so let me tell you in brief that this is a Doctor of Biological Sciences, head of the Regional Center of Neonatal Screening, a scientific supervisor, and just our best friend. Thank you. I hope I can see my presentation on the screen. So, good afternoon, dear colleagues. First of all, let me tell you that I'm happy to see all of you here. I'm happy that we have gathered here. Well, and I'm sorry for those changes on the agenda, because I really couldn't stay during the whole conference with you, but I'm really with you, and it's very precious that I can stay with you, in particular with our foreign colleagues, Anna, Katarina. And let me tell a couple of words about the following. When Larissa told me that I should have a presentation, I decided to tell a couple of simple words about genetics. Where from these genetic diseases come, what is CFTR, who needs DNA test, and how do we use the results of those tests for treatment. And the fact that genetic diseases are very rare and we don't have that many of them, it's a well-known fact. But now, when the war broke out, I understood that we are all the carriers of genetic diseases, each of us. Yes, we have here a special group. It's not the overall sampling, but the population as such includes all the carriers of genetic diseases. And if some carriers get together and they get children with some genetic modifications, it's like an analogy for me. Well, what is happening at the front line? We are all at war, but at the front line we have only some individuals. And when war broke out, I had already been engaged in genetics and genetic diagnostics for many years, and I kept asking myself all the time, we seem to be the same, very much equal. We are supposed to have the same challenges, but someone is staying in the front line. So for me, those patients and those parents and those children who have faced those problems are the ones who are at the front line, and we all as the society need to be responsible for those who are there at the front line, because they find it the most difficult to survive. It's them who are facing those challenges. Our Ukraine, as compared with the whole world, is at the front line. We can use this allegory, and I think that in our society we need to realize that we need to support those people who are at the front line. So these are the diseases each of us can have. It's happened because of the circumstances that two carriers got together and their children are included into this list of 25 people. The mutation was actually handed over from one generation to the other. In that family, each of us is the carrier of those genetic diseases. But if a man and a woman get together, they are the carriers of the same mutation, and they are within this group of 25%. So the affected gene comes from the mother, from the father, and they have this combination. Cystic fibrosis is the condition which is caused by the disorder in protein, which is a kind of a channel. You can imagine a channel. A channel is something where water flows, or cars are passing. So it should work normally. The chloride ions should go there. But in case of cystic fibrosis, this channel doesn't work. And cystic fibrosis is not chronic bronchitis and not some recurrent immunodeficiency condition, not all these diseases that we have. But cystic fibrosis is only when we have those consequences for pulmonary disorders. So these are the things that are caused by the non-working channel it just gets stuck. The cars cannot pass there, water cannot flow there. So this channel is the CFTR. There is another myth that genetic diagnostics is a very expensive, complicated, and unaffordable thing, and DNA analysis is something that is very difficult to do. But I think that we have dispelled this myth. This can be done. That's what we are doing. And the laboratory workers, scientists are doing this on a daily basis, and they make it more understandable for us. Yeah, welcome to Katarina, because she's really a very good friend of mine, of ours, so I would like to welcome her here. So, CFTR, if everything is good, the chloride is moving along that channel, but if we have different transformations, we need to know what type of mutation we are facing, because their misfunctioning is different. Some people don't have channels, in some people, this channel is just non-working. In some people, there is just a small portion of the channel, and through DNA analysis, geneticists can actually identify what mutation of CFTR we have. And what is the mechanism of non-functioning? Is it that we have a block, that the canal has been stuck, or it's too narrow, or the passage, the flow is very slow there? So they need to identify how it is unbroken. And the DNA analysis, the DNA test, helps us understand these combinations, these variations, and helps us understand why this new treatment can work for specific variations, for specific mutations. It's very important that this gene, or this peculiarity that we have got, can be very much specific, and there is the database CFTR2 available on the internet. And if you put the name of your 1 and 2nd LL there, you will immediately get the information on what is known about those variations, whether we may have Trikafta or Trikafta to treat it, and whether this mutation is going to be accompanied by pancreatic insufficiency or not. The other thing I would like to mention is that the same variations can be recorded differently. Well, suppose I'm Halia, Halina, Halusa, my name can be differentiated, but that is the same name. So it's like one and the same genetic form. So sometimes don't get frustrated if in Germany the name of the very mutation is written in a different way. This may well happen. For example, we have mutation of the same gene as F508 delta. So ask your geneticists, or don't get lost. If a child has cystic fibrosis, this means that in 2 alleles there are the chained options, and that channel doesn't work. And now, it's important that if you have a child, with changed mutations, one should come from the mother and one from the father, which means that parents should have a DNA test. Why? Because it may so happen that there are 2 variations, but he's healthy, because the child is just the carrier of those 2 variations, but he is healthy. It happens rarely, and sometimes we have not 2 but 3 mutations in a child. So the conclusion here is that if you do a genetic test, it's important at the stage of diagnostics to prove that all this comes from both the father and the mother, and one hand is broken in one way and the other hand is broken in the other way. But it may be that 2 fingers on one hand are broken while the other hand will be working. These are healthy carriers. For example, one of my hands is now working. I'm holding a microphone with it. Why do we need to identify those healthy carriers? Because the risk for every new pregnancy will again be 25%. What does it mean? Because sometimes they say that if parents have one unhealthy child, the other child will be healthy. I've heard about interruptions of pregnancies 3 times in a row. But you know, the chances of having a healthy child is in fact 75%. For some reason, everybody focuses on those 25%, but let's have a look at the fact that the chances to have a healthy child is 75%. And we have a lot of preventive measures. If you start these preventive measures from the beginning or treatment from the beginning, it's not such a problem. Is prevention available? Well, prevention is actually not available. We may have early diagnostics. The moment pregnancy comes, you may have prenatal diagnostics when from the waters from the uterus are taken from the fetus, around the fetus, and we are judging by the level of amniocytes. And the other diagnostics is pre-implantation, prenatal diagnostics, when at the stage of fertilization the embryos are checked for the combination of genes, and you fertilize only the embryo where one variant or none of the variants has been changed. And this is also early diagnostics, the kind of pre-implementation diagnostics, which is accompanied by a use of auxiliary reproductive technologies. What about screening? All children who were born in Ukraine after 2018 undergo this neonatal screening, because in 2017, well, somewhere we had it, somewhere we didn't have it, but since 2018, every child has been checked, has been undergoing this neonatal screening for availability of CF. It's not a genetic diagnostics. Screening is not a genetic one. Screening is just checking for some RT markers, and then the child is undergoing diagnostics. So all children born in Ukraine after 2018, to put it roughly, undergo this diagnostics, early diagnostics, to launch treatment in time. That starts with the dry spot of blood, and it's available in every region of Ukraine. The next question is, what families will have the risk of having a child with cystic fibrosis among the patients? You know, the patients, I will still get back to this issue. So DNA test shows us not only whether this is cystic fibrosis, because after screening we have spot analysis, spot test, and we also identify what kind of cystic fibrosis this is, whether it is eligible to treatment, to this or that treatment. And this is my slide about DNA diagnostics and about the risks for CF patients to have a child with CF. I would like to unite this slide to the slide where we have the number of pregnancies among women with cystic fibrosis after modulator therapy. You can see that the frequency has increased twice. This is the data from the US registry. After the modulator therapy, the number of cases, of pregnancy cases, has increased twice, which is a great number. What does it tell us? It, first of all, shows us that the health of patients has become better. Their conditions allows them to get pregnant. Secondly, they got hope that everything is going to be fine with them and they will live longer. And as for me, this also means that the risk for them gets lower. And as we mentioned at the beginning, we have the combination of genes from the mother and the father. So the risks for these women of having a child with cystic fibrosis depends on their partner, not on them. They have two alleles, but this depends on the partner and not on them. for the partner not to be a carrier. That's what is important. So we need to have this information, and the number of pregnancies may increase. And from this slide, I would also like to say that about the role of science. These people, the researchers, are the ones who are actually at this front line. They keep helping everyone, because for this mechanism to start working in that way, many researchers have had to do their research on a daily basis for this just to become possible. And one day, INCF Trust, which is the London-based patient organization, asked me, told me what they are raising money for. They are raising money for research, for the researchers to be able to study something and to find something to improve the life of their children. So it would be good if our vision also changed, our attitude to science, to research changed. And maybe that is also a kind of a solution for the Ukrainian armed forces. Why did the situation improve? Because we had research. So let's appreciate research and researchers, and let's make a breakthrough in that direction. Is it only treatment that increases life expectancy? Is it valid only for F508 delta? No. It's also valid for other mutations which similarly affect the chloride channels. But let me mention that these rare mutations are not available in our patients, but we need to check it, to verify it every single time. What about the patients that don't have this mutation, F508 delta? Let me again refer to research. Research is advancing. On a daily basis, we have a lot of research done on organelles, on organoids, where you just take the cells from the patient and research what molecules will restore this transportation movement in the channel. We've got some findings, and I hope that in some time treatment will come for other types of mutations, because we're supporting research and we really hope that it will make a breakthrough. To conclude, there is such a question, because now every presentation is supposed to end up in a question. So pathogenic mutations causing CF are mainly come from the the neighbor, from the father-in-law, from the mother-in-law. But let me remind you that it comes only from two parents at the same time. Otherwise, we cannot have cystic fibrosis. It comes from two parents at the same time. Thank you for your attention. I've also got another logistic issue, because I hope that we will keep working and the researchers will keep working. I've just come back from Germany, and I'm really grateful to our colleagues from Germany. It was yesterday that we got the sweat test substances, Chlorodac, for Western Ukrainian Center. They are going to be distributed throughout Ukraine, but they are highly specific, because when we can collect this, but we need the measuring devices. So I think that we will discuss this with Larissa. Please contact me if you need those devices. These devices should be in the hands of the people who know how to use it, because they are not cheap devices, but we have got 15 microducts and consumables for 500 tests, which is quite a lot, almost for every patient. So thanks a lot, and our goal is to have, for patients with CF, not to have any manifestations of this disease in the future. Just let me say that from the very beginning, when I started representing patients with CF, the first thing I wanted to do was to unite the heads of units and patients. Then I wanted to unite physicians and heads of units and patients together, because that must be a strong, powerful community. And I'm really grateful to you. It seems to me that we managed to do this. And let me give the floor to Lesa and to our girls. Helena, you're really doing incredible things for us. Thanks a lot for all the work that you're doing for us. As you mentioned in your presentation, really, we were at the zero level, but thanks to your daily work, to your association, to our highly distinguished doctors, we managed to do it. So we are respecting you so much, and we would like to give you flowers. Well, in fact, we are staying all together, and our achievements are common achievements. And I think that victory of Ukraine, that will be the victory common for the whole Europe. So thanks a lot to those who are staying in the front line, and let's support them. Thank you. Colleagues, so our timing changed a little bit. Our lunch will come at 2:10. So I hope that we will listen to all the presentations before lunch. And now let me give the floor to Olena Vashchuk, who is the head of the Lviv Regional Hospital for War Veterans of the therapeutical unit. She is one of the first to research modulator therapy for adult patients in Ukraine. You're welcome. Good afternoon. Thank you for the invitation. I'm happy to see all of you. I've entitled my speech "The Problems and Ways of solving the problems with treatment of patients with cystic fibrosis in cooperation with patient organizations." Our adult centers of cystic fibrosis has been hosting patients since 2018. In our center is located in Lviv Regional Hospital for veterans, war veterans, and we have got 2 beds in the therapeutic units for patients with CF. In 2018, in our adult center, we had only 19 patients registered. Now, we are taking care of 48 adult patients, 37 of which are residents from Lviv region, and 3 patients are IDPs, and 8 patients are patients from other regions of Ukraine. What about the itinerary, the pathway of an adult patient with CF? Probably you are very much concerned as to how you can get to us. We've got a memorandum of cooperation between our hospital and the Western Ukrainian Specialized Pediatric Health Center, which means that patients who have come of age are referred to our center on the basis of the results of the examinations and discharge documents, and we accept them. Also, we may have adult patients from Lviv region if they have a referral from their family doctor with the suspicion of having cystic fibrosis. In case we have inpatient treatment beds, those patients from other regions can come, but this happens only if this process is approved by our center. Here is the graphic pathway. Now, unfortunately, we have a major problem because up till recently, the adult center consisted of 2 specific wards, 2 separate wards equipped for physiotherapy. But in October, because of the reorganization of our therapeutic service and repair works, we haven't had any permanent wards for patients with cystic fibrosis. But the administration of the hospital intends to create a new center to provide assistance to such patients since 2024. Our team includes a pulmonologist, a therapist, otolaryngologist, endocrinologist, gynecologist, urologist, eye doctor, psychologist, and resuscitation therapist and rehabilitation expert. Our oldest patient is 43 years of age. The average age is 24, and unfortunately, out of 48 patients whom we are treating in the center, 37 are have the pseudonym aeruginosa, and at least one patient has this mutation of the gene. Actually, 38 patients have the mutation of gene 508 delta. We have started target therapy, and 15 adult patients are getting this target therapy. When I was getting ready for my presentation, I asked my adult patients what problems they are facing in their lives. And I would ask you to listen to what my patients say. Please help me with the video. Every month, when I get a prescription for free of charge drugs, I'm offended, insulted, and they are trying to change the treatment, explaining it by the fact that local authorities don't have money. Probably the major problem is getting the necessary medications. In my adult life, the main problem is going through the MSAC commission, because the disability group is given for 1 or 2 years, and you need to take a lot of time and effort to renew your documents. The problem are with limited number of specialist centers in different regions of Ukraine. I've come to realize that being a patient who is already of age, I've become more helpless, and at some point in time I even thought that we are fighting for our place in the sun. The problem is in due provision of medications that are vital medications for me. So there are two tags together, and one of them is about plans and duties. So there are many plans and duties that are postponed, since due to deteriorations in health condition, you get to hospital for a long period of time, and definitely this obstructs your job and studies. Since CF patients don't have to contact with a large group of people, all the more live in a dormitory, I cannot talk about any full-time studies. I have become an extramural student and to work on my curriculum on my own. The first and the major problem is sense of inferiority. You cough at every moment of your life, and you look pale. So, in fact, you spend about 1 hour a day for physiotherapy, which is quite a lot. Trikafta has solved most of those problems. I feel my disease in particular in the period when I feel sick and lose my study days. Then it comes to the difference between the opposition of your career and self-development. The problem with family creation, well, there are no spermatozoids in my spermogram. That's why for the reproductive function I will need to address the reproductive health specialist. Of course, I was not concerned about this in childhood. Family is the main topic for such a patient as I am. Not every girl or woman is ready to love you the one you are with this disease and with those daily procedures that you just need to undergo in your life. I've been dreaming of the medications that will change my life. I want to live. So this patient has 2 rare mutations, and unfortunately he is not eligible for Trikafta therapy. The main problems, let's summarize, on the way to fighting cystic fibrosis in adults are financial and economic ones. Unfortunately, there is no sufficient state funding of adult orphan patients in Ukraine, including patients with CF. The military actions, the hostilities that make people leave their places of living, make it more complicated to provide qualified medical care locally. Absence of sufficient number of adult specialists and centers, psychological problems. Quite often when the diagnosis of CF is set in an adult age, that is all about denial of this disease, a conflict in the family, absence of self-discipline, among adult patients, the sense of shame for their disease, and a number of psychological and social problems. What are the solutions? Definitely, that is compliance with the legislative framework of Ukraine that guarantees protection to our adult orphan patients. That is the law of Ukraine of April the 15th, 2014. That is the resolution of the Cabinet of Ministers 160 of the year 2015. Resolution 1303 as of 1998. This is also correspondence to the concept of developing healthcare to citizens, as well as assistance coming from local authorities to IDPs, study and training of adult specialists, because in Ukraine we really have very few adult specialists and centers dealing with CF patients. Another solution is popularization of orphan centers, training in international clinics, and I think that here the role of patient organizations comes into play, because this internship, this training is very expensive if we're speaking about international clinics. And for pediatricians, it's also the search of specialists to whom they will give over their 18-year-old patients. Also, we need to invite psychologists to work with patients and families of those patients with orphan diseases. And I can tell you that you don't just need to fulfill state programs. The responsibility for our life is left on us, lies on us. These are my adult patients who allowed me to take their pictures and to show them. A girl, an IDP coming from Donetsk region, who came here, and this is the first picture here. And I'm really grateful to foreign specialists who treated her in Krakow at the beginning, then in Dublin, and now she's undergoing treatment with us. And you can see the results of treatment. Then a girl from Lviv, whom we know very well. The picture is done a year later. And this is an adult patient whose diagnosis was set when he was already 30, when he and his wife were making an examination because of unfertile marriage. And they were going towards the goal, and now they are bringing up 2 children. And that's what the patient looks like if he follows all the recommendations. Our tasks are as follows: to preserve the life of our citizens, to expand their life expectancy, to use all the resources in the adequate way, to promote application of the principles of accessibility to all the units of healthcare provision to citizens with CF, ensuring compliance with international educational standards and training of experts, application of recent information technologies and approaches in the system of healthcare provision. What I would like to say, I'd like to say that when we're treating orphan patients, a great role belongs to patient organizations, because it is patient organizations that are the driving agents in the fight for the health of our orphan patients. What about our experience? Well, of course, these are Ukrainian organizations. I'm grateful to Larissa. We have we'll have Tatiana Kulesha. We have their NGO dealing with orphan diseases. They are really doing great things. They are doing the coordination. They are distributing humanitarian aid. They are holding negotiations with the Vertex company, with the Ministry of Health. And I think that it is thanks to you that our patients have this target therapy. So thanks a lot for that. On my own behalf, I would also like to express my gratitude to you, because this year, in response to the All-Ukrainian Association of Care for Patients with Cystic Fibrosis, it was for the first time that money was allocated from Lviv Regional Program for adult patients with cystic fibrosis for the year 2024. So I'm really grateful to you, because this came as the first time. Uliana Krasnik, Oksana Darmoriz, Lesa Mroz, Maria Pitsudok, I'm really grateful to you, girls. This is our Lviv unit of cystic fibrosis. What are they doing? They are doing incredible things, which is all about organizing events dedicated to cystic fibrosis. And now, in wartime, it's about sorting and delivery of humanitarian aid. They really did it in the nighttime to deliver those packages throughout Ukraine. On my personal behalf, I would like to express my gratitude to Uliana Krasnik, who went to Poznan with me. She was my personal interpreter. We had an internship there. And also, there was a good master class of Master Martin Spacek, a diet nutrition expert from Poland. And well, we are all working. We have got achievements. Also, express my gratitude to the Charitable Foundation, the Patients of Ukraine, because they have provided a spirograph devices for our center and some medical goods. And Charitable Foundation Kryla Nadii, Natalia Lipska, she is helping us with medicines. Thanks a lot. As far as European organizations are concerned, I don't even know how to express my gratitude to you. Slovak CF Association, Katarina Stepankova, thanks a lot to you. Thank you so much. You are an incredible woman, and you have done so much for us. You've been teaching us. You've been holding those master classes on physiotherapy. You've been training our physicians, and in wartime, you were just rescuing the lives of our patients. Thanks a lot for that. Poland, Matthew Foundation, Pavel Wojtowicz, and other foundations from Poland. This was about evacuation and treatment of our patients. This was supply of medications, devices. This was training of our specialists. So I'm really proud of being friends with you. Germany, Adam Spender, Sabina Vohel, Kristina Poplavska. Well, these are the people. Well, I think that they have saved the lives of our adult patients because medications, antibiotics of such high quality have never been supplied to us in sufficient quantities. That's their achievement. The European Association, well, definitely humanitarian aid. Negotiations with Vertex, target therapy in Ukraine, and also engagement in the European CF registry. Europe, we are so much grateful to you. Sorry if I have not mentioned some names, but we really appreciate what you are doing, and let's hope that we will keep being friends and you will not forget about us, and we will always be grateful to you. And I would like to finish my presentation with the words of Taras Shevchenko, which will be in Ukrainian. And they say that there will be no enemy on the upgraded land. There will be the sun, there will be the mother, and there will be people on the earth. Thanks a lot to all of you. Thank you, Olena. Your experience is definitely very precious, and that has been a very informative presentation. And I would like to mention that, from time to time, we all realize it perfectly well in what reality we live and what each of us has experienced. Definitely, each of us has faced some difficulties, and I'm more than convinced that over these almost 2 years of war, that has been a very difficult time for the whole of Ukraine. Each of us has had a feeling of uncertainty, inconfidence, helplessness, despair as to what will come tomorrow. Will tomorrow generally come or not? Will we have night today? Will I wake up tomorrow in the morning? I think that we all had such thoughts, but that was a turning point on our path towards gaining what we now have and achieving what we now have. And before I give the floor to Natalia Honchar, I would also like to say the following, a very important thing, but which is very simple. Suppose here on my table I have a bottle of water which is half empty or half full. So it all depends on what is our mood inside us and what can urge us to take some action tomorrow, in a week's time, in a year's time, and during this year. So it would really be great if each of us had this positive interpretation of what I now have in my hands. I have a bottle which is half full and not half empty. Thanks a lot, and let me give the floor to Natalia. Natalia will have a speech entitled Innovations in Respiratory Tract Clearance. We are really grateful to you for your active standpoint in Ukraine, for your active work, And let me once again express my gratitude to Katarina, because long ago she showed me in Europe, I don't know at what conferences took place, that there is some equipment that really works well. So let me invite Natalia to have your presentation. Thank you, dear colleagues. You know, I've been listening to the presentations yesterday and today, and I've got the impression that here in the room we have a large family. A family consisting of parents, public figures, our experts, foreign experts. This is the community doing great things for our children with cystic fibrosis. And I'm deeply convinced that it is thanks to you that these children will have their future, will have longer life expectancy, and this will be high quality life. And I'm bowing low to all of you, and Larissa, since you are kind of a think tank of this organization as the organizer, I wish you good health, and you are always keeping your fingers on the armrest, so let your pulse also stay in good norm. Your energy should always be very high for you to be able to do a lot of things. That is because you're always keeping your fingers on the pulse. Well, I'm a little bit anxious and concerned because my native language is Ukrainian, but it so happened that my father was actually a serviceman, and for a certain period of time I didn't live in Ukraine, and now I'm kind of learning Ukrainian, speaking Ukrainian, so please don't blame me too much if I use the language not in the right way. And I want you to hear what this device can do for our children. We are all tired. Lunchtime is coming, but let me give you a couple of examples. Yes, this is already the next slide. So I would like to say that our life is counted not only with the number of breaths, of how many times we breathe in and breathe out, but the number of events that are breathtaking. So I want you to have a lot of such breathtaking events in your lives and in the life of your children. So first, I would like to show you some interesting things about the respiratory system. The number of alveoli in our body is about 500 million, and the area is about 100 square meters. So this is what our respiratory system looks like. And within a year, a person makes about 8 million breaths in and breathes out. And per day, the person breathes in about 700 billion harmful particles. So when this mucociliary tract works well, all those particles, harmful, hazardous particles, leave the organism. But when we have a person with muco-obstructive syndromes, those 7 to 70 billion particles that get into our lungs on a daily basis stay there. So the main task of doctors is to ensure this mucociliary clearance and to make those particles leave the lungs of humans. For you to understand how the Semiox device works, I would like to talk about the physiology and anatomy of our bronchi and lung system. Our bronchopulmonary tree has about 36 generations, like branches. It's like a tree having the branches. And the generations from 1 to 23 are just about the leading system, which means that the air is moisturized there, is cleared there, and warmed up. And only from 24 to 26 generations, these are generations that deal with respiration, with breathing, where the gas exchange is taking place. If we have a look at mucus of a healthy person, that is hydrogel that consists by 98% of water, and about 1% is salt and globular proteins, and only 0.3% is highly molecular polymers, mucin. And these ones play a major role in ensuring viscosity of our bronchial secrete. Their mucus has two layers. So the mucus is of two layers. The gel one, the surface one containing a lot of soluble mucins, and this layer provides us with adhesion of those particles that get with the air to the lungs. And we also have a layer, pericilla, a layer that contains this epithelium. This is the liquid one, this is not that liquid. And you get there the ciliary epithelium fibers that ensure this mucociliary clearance. So that is about the movement to the upper parts where we cough it off. So in a healthy individual, this layer is highly moisturized, everything works well, and mucus actually performs its physiological function, which is clearance and taking those particles that get into the respiratory tract out of the body. But if a person has an obstruction disease like cystic fibrosis or chronic obstructive disease of lungs, oh, sorry for that, it's the wrong slide as yet, or bronchoectasia, they have a disorder in terms of the synthesis and transportation of this mucus, and it becomes demoisturized. And then this mucociliary transportation is violated. Then mucus is accumulated in all the parts of the respiratory tract. And the bronchial cells get destroyed, and of course this violates gas exchange. Then mucus is a perfect environment for bacteria colonization, and the main reason for exacerbations and lethal pathologies in cystic fibrosis is mainly some disorder in the respiratory system. That's why we should be so much scrupulous about respiratory tract clearance, airways clearance. So what about this Semiox technology? It's based on the mucus thixotropy, which is the capacity of a substance to reduce viscosity in case of mechanical effects, and to increase viscosity in case the mucus in the quiet condition. So the PhysioCyst company, in collaboration with the National Center of Research, which is the French center, and the National Institute of Health, France, in CERN, over 5 years studied the physical properties of mucus in order to identify the threshold value after which mucus becomes liquid. I mean, if we have some mechanical effect. And in that way, we developed the Semiox technology. They developed, actually. They found the signal that makes the mucus more liquid, as you can see it in the slide. And this signal also kind of takes a part of this mucus, it actually separates this mucus from the walls, and as a result of that, the ciliary epithelial fibers start functioning, and this mucus gets transported into the upper part of our bronchi, where we can cough it off with normal cough. Now we've got a lot of physical methods for airway clearance, which is ordinarily pastoral massage therapy or its modification for independent application. Oh, sorry, the wrong slide again. So it's modification for independent application, which is vibration vests. These are also some respiratory breathing exercises or application of positive pressure on breath out, like PEP devices, or positive pressure with some fluctuations of PEP. And a lot of these methods are available, but if there are so many of them, what does it prove? It proves actually that all of them, well, so to say, all of them are not all of them are effective, or rather, not all of them are a panacea. And there was a research done in patients in terms of their predisposition to those methods, and it appeared that many patients claim that some of these methods are highly exhaustive, some of them are pretty much time-consuming, other ones are not effective at all. So PhysioAssist has started developing its own invention related to this therapy signal. So what is it like? Semiox generates the sequence of short-term oscillations, which is impulse liquefaction of the atmospheric pressure with a frequency, the same frequency as our fibers work, and this is about 15 movements per minute. So this frequency that has been selected by PhysioAssist is the frequency of those oscillations. So those oscillations give a pneumo signal which creates vibrations that penetrate into the lowest part of lungs, as a result of which, I've already shown this to you, this mucus gets liquefied, and mucus gets separated from the walls and is evacuated to the upper respiratory tract. Why should this semiox be used? Because the patient is in the condition of the quiet. The device works only when the patient breathes out physiologically, so that it's not exhaustive. The procedure takes about 15 minutes, which is a short period of time, and you can find this time on a daily basis for semiox therapy. And the therapeutic goal of semiox therapy is to reduce the infectious exacerbations to the minimum, as well as to improve gas exchange and to improve the quality of patient's life. And here is the principle of its work on the video. So we can see a patient who breathes in very slowly. Then he presses the button on the remote panel and breathes out slowly into the tube. And over that period of time, oscillations start. Here you can see the breathing in, then pressing the button, and there come oscillations, the PhysioAssist signal. And let me draw your attention to the fact that when our lungs are full of air, the signal is lower. Well, something must be wrong with this clicker. I'm pressing the wrong buttons. I wonder if you could help me with this. So when our lungs are full of air, when air is in the lungs, the signal is low, but as we breathe out, when there comes to be less air, the signal increases, which means that at the beginning these oscillations are aimed at liquidification, but at the end it comes to taking the mucus out to the upper part of the lungs. And yesterday, if you wanted to, you could actually see what it was, how it is done. You can feel it. In this slide, you can see the difference between the situations when we use an ordinary pump, and you can see that mucus is not moving at all, and the use of ordinary pumps may lead to some side effects. While here with Simox, the signal is generated and you can see that mucus moves to the top, to the upper part. So here are the advantages of Simox therapy. First of all, this is evidence-based sputum liquidification, then this is ease in use, clearance of distal respiratory airways. It's autonomous, you don't need any assistance, you do not get exhausted, and it's just 15 minutes. So the result is that you feel that your breathing process has been restored. What about the use of the Simox therapy? In Europe, a number of clinical researches have been done in relation to the Simox therapy, and they prove that all physiological pulmonary functions improve, and the V also increases. What decreases is respiratory symptoms like cough, apnea, and people prefer Simox because it's easy and it's inexhaustive. And this also increases predisposition during this therapy. Where can we use this device? Well, first of all, in hospitals, where we have people with exacerbations, children with exacerbations, to shorten this time of exacerbation and to bring it in a child into a normal condition. Also in physiotherapy centers, in the period of remission, in order to prevent some exacerbations, and also in home care. This is the device the patient should stay with all life long, and when there is too much mucus, he can actually remove this mucus from the lungs. Today, together with the Association of Care of Patients with Cystic Fibrosis, and together with the Dniprovska Varta NGO, we have developed a project on the procurement of 57 Simox devices in Ukraine, for Ukraine. I think that this is just a matter of time. This project will start functioning very quickly and very soon. And our goal now is to introduce into the CF patient protocols, treatment protocols, the use of Simox device for us to be able to procure consumables or tubes for the hospitals where we are going to supply Simox devices. So this is our task number one. And now let me show you a girl with CF with pneumonia, bilateral pneumonia, and respiratory insufficiency, which actually led her to the resuscitation ward. And I want you to see how in 2 or 3 breathings in, what kind of mucus gets out of the body. I wonder if you could show this. So you can see how much comes as a result of that. So that is for the sake of what CIMAX works. Thank you for your attention. I'm ready to take your questions, if any. Please ask the question to the microphone. The interpreters cannot hear you, and our people online cannot hear you. So the question is, so in this Polish clinic, when there is a breathe in, is it oxygen or mask? Oxygen. So this means that this is the sequence. Yes, this is oxygen-dependent therapy. That is important that we support the necessary, maintain the level of oxygen, because I didn't see the figures on the pulse oximeter. Yes, we did a clinical trial with home care children who have already bought Simox, and we arranged a procedure with Simox together with pulse oximeter on the finger, and we started with oxygenation 92, and after the treatment it was 95, 96. Well, that was the result. I represent Lviv Center, and we have this Simox device. I would like to support Natalia's argument. It is really a very good device. It gives a very good effect, in particular in combination with Trikafta. So I suggest that all the centers that will be created need to have this device. That's what we are working on. Yes, please work on that. Thank you. No questions? Any other questions? Please wait. Natalia, maybe somebody has got some question. Maybe there are questions from the audience. Well, anyway, I'm staying here. In case of blackout, in case there is no power and light, can you work with such a device on generators? Well, if you have a generator that it provides you with electricity, then yes. 220 volts. That's what you need to have. What about their capacity, the voltage? Well, I haven't paid attention to that. I will just need to have a look at the device. What about the cost of this device if you buy it for a child for home use? Well, in France, the cost of this device is about 4,500 euros or 5,000 euros. But if you bring this device here to Ukraine to take it through the border, this is a medical device, you know, which needs to be brought in. Well, if it's just one device, the transportation cost will be 72% of the value of the cost. But if we bring in several, the transportation costs may be about 19%. So really, the logistics is very expensive, and there are different customs duties that you need to pay. So it's about 6,000 euros plus minus 10%, depending on how many devices we bring in. The cost of tubes, because you have two types of tubes for this device, like they are individual for every patient, and you have tubes for 25 seances and for 10 seances. So the tube for 25 seances costs 50 euros. Well, it's almost the same as in Europe. It's easier with the tubes. Well, I think, well, Natalia, thanks a lot for your presentation. And let me also add that we still have some questions. Yes, I'll be brief. I would just wanted to specify whether this device is for daily use or only during the period of exacerbations, and how are you using this device in the center to which several patients come to have a seance? What about the whole procedure of with those individual tubes and safety, security? Well, thank you for the question. I cannot tell you how the center works, and only the center can tell you about this. I think that they have some registration procedure, and you come to the time appointed for your treatment and for getting this treatment procedure. But as far as the use in home conditions is concerned, you do everything under the supervision of your doctor, in the sense that if you have just started doing those procedures, you can use it twice a day to have this airway treatment clearance. But if you have already reached some results, you have made this clearance, you can just have to maintain the same condition of bronchi. So you can be using it once a day or 2 times a week. It depends on the condition of the patient and on the accumulation of the secrecy of this mucus in him. Here is another question. The masks, are they universal or are they age dependent? And what is the age limit for these procedures? We don't have mask there. It's just a tube with a filter. And there are also some caps for that you took it into your mouth. The tube is per one patient. The caps are individual, where the tube for 10 seances or sessions, so you have an individual cap, where we have tubes for 25 seances. There are 3 caps. We use chlordexidine or some other 50 to 50 peroxide hydrogen peroxide solution, and then we keep using it. Why is the tube so much expensive? Because of this filter. Because it absorbs about 90% of bacteria. And you know that our patients have different flora. And when you breathe out directly into the device. The air always comes from the patient to the device. That's why these filters are so much expensive. And the most important thing is that if you have already used 10 or 25 sessions, the device will not see this tube. It will not use it. You will need to have another tube. Thanks a lot for this. And let me also mention that taking into account the price, I need to remind you that while getting ready for the conference, we discussed with you how we could help centers with this device, or how we could help the hospitals where our patients are concentrated and where there are physiotherapists. Probably we should do our best to really help those hospitals and centers work with this device. So let's hope really that, as we have discussed, after the 20th of November, we will be able to again ask the Ministry of Health for support, and probably they will address France directly, and let's hope that we will achieve this, because really we cannot tell 100% when we manage to do this, because we know that we are Ukrainians, we are a reactive nation, we are always in a hurry to live. We need everything here and now, and the sooner the better. But it doesn't work that way, so let's move at our own pace. We move in that direction, in the context of what you have told about and taking into account the high cost of this device. I would like to tell you that this device has been registered in Ukraine. It's a licensed one. This is important. Why important for heads of units present here? Because taking into account what was mentioned yesterday, well, yes, we all understand that there may be different budgets, different funding, the priorities are different, but taking into account the fact that the device has been registered in Ukraine, you can, and you actually should, have negotiations with the departments, with top officials, with the deputies of local level, for them to try and find the finance and to help the hospitals where your patients are treated to at least acquire those devices. And I think that Natalia and her team will be able to come to pay a visit to your centers and hospital and to train you how to do it. Besides that, we are really grateful to our cooperation with Europe, to Hugo, physiotherapist from France. It was him and Matilda and other experts. We are grateful to Katerina for kind of keeping her fingers on the pulse in that respect. They have come a number of times to Ukraine to show how it works, why we need this, and really we've got great achievements, and we need to say that in Ukraine, as for now, well, I cannot mention the name because the mother didn't give her consent, but we have got a patient with very rare mutations, but the mother was collecting money for many years and she was deciding what to buy, a car or this device. And she bought this device. You know whom I'm talking about. She bought this device, and this device was not yet even registered in Ukraine. She perfectly realized that the therapy currently available is not good for her child, so she underwent training, and you were showing her what she needs to do and how she needs to do it. And as for now, the condition of the pulmonary function has improved several times. We all understand that teenagers are within the age period when they are overwhelmed with emotions, with hormones. They are facing their own difficulties, but in case this device is used in the right way, and if a person himself or herself is working at his or her health, a lot depends on that. And thank you for promoting this work and activity in Ukraine and this device. I would also like to say that as far as home care is concerned, we don't have too many devices in Ukraine, and that's why I keep in touch with all those patients on a regular basis, and I have a very good impression of what is happening, because suppose a mother gives me a call being over emotional and says just, "Mom, I feel so good here." He started eating better, he started having better performance at school. Well, he went in for football, but now he started going in for football more actively, and he's less tired after those physical exercises. So, for the sake of such achievements, of such cases, I'm ready to work. I think that we all should work for the sake of such emotions. And I will really do my best for us to have in our centers, in regional hospitals, where we have such children, not only with CF, but with some other diseases like mucous obstruction, for us to have, for our centers to have such devices. Thanks a lot. Colleagues, so we have, as you can see, changed our agenda a little bit, but now we will have lunch time, and we are getting back at 3 to this room. So please go and have your lunch, and please, the parents who have come today, please take into account the fact that you have to stay here, and all the others who arrived yesterday can go and have their lunch right away. Thank you. So, colleagues, we just have my presentation at the end, and I hope that it will be rather useful for everyone of those who is present here. And before we start working, everyone with himself or herself, I want to remind everyone that, well, you actually feel it yourself, that we live in tough times, in difficult conditions, and as mentioned by me yesterday, sometimes we understand that we are kind of Ukrainians kamikaze, because during the shelling, none of us knows what will come after that. We are kind of suicide murderers. But our internal and external resources help us stay here and now and be the ones we are. I would also like to remind you of the fact which I mentioned yesterday. I know that in most families, in your families or in your extended families, you have people who are at the front line, or there are some children who are living through some psychological difficulties. So let me remind you that we have the Pro Bono Psychological Aid Association in Ukraine. I volunteer there and I provide psychological aid to servicemen and their families. The short number is 5522, and before I actually start my presentation, I would ask you to watch a short video. When you're wounded, it was my first time I was wounded, so some things that happened to my brain were not known to me. I didn't realize them, and if I didn't address the psychologist, I would probably have lost more time and more health that I needed badly to get back to normal condition. To address a psychologist is in fact about saving some time and understanding what really is happening to you. And this is just the guidance on how you can be using your brain, because your brain, unlike a physical body, if traumatized, is not bleeding. It means you cannot see that it has been traumatized, but after injury, it really often gets traumatized. That's why you need to go to a psychologist. And he will definitely show you how you can return home. This is just a kind of a navigator to yourself. You have someone to tell everything to. Give a call. Quiet for the sake of victory. Let me remind you once again that you can give calls to this hotline. And before I start my presentation, I would like just to have a short exercise, quick exercise that will help you to kind of switch your attention to working on yourself. We want to launch your neuron connections in the way that the work that we do, each with himself or herself, be effective for each of you. Taking into account the fact that I have a microphone in one hand, I cannot be doing this with two hands, but I would ask you to do this with two hands. Here is your hand. And in turns, you have to connect your thumb to the little finger, and vice versa, and then quicker and quicker, and 3 times in a row. Do it. This is the exercise. You should preferably do it with 2 of your hands, just I cannot do it because I have a microphone. This is the exercise that is very useful for doctors, because you can actually check what the condition of the person is. how adequate this person is. That's true. You understand what I'm talking about. Come on. It will show you how sincere this person is. So it's an easy exercise, but it really helps you to switch our attention and our brain to something else. So the first day and the first session covered emotional stories, but now I would ask you to stay relaxed a little bit. Let it be kind of a home atmosphere. And let us work together with you, and please perceive me just as your best friend, Larissa. Not the president of the association, I'm just as you are. So let's start. The search of one's own resources aimed at self-fulfillment of the personality of an individual in the society. For more than a year, I've been working as a psychologist, private psychologist, and together with my team, I have been working. I've been mentioning this team time and time again. So we support people who are at the front line, who are there in the areas of hostilities, who have such friends or relatives who are at the front line, and quite often questions are raised that a person loses a sense of life, and really there are a lot of challenges with which we need to somehow fight here and now, and with which we definitely will be fighting over the years to come, even after the end of the war. But we're strong, and we will manage to do that. I would like to focus on saying that our brain is structured in the following way, and I would ask physicians not to condemn me. I'm not a doctor, so maybe I will tell what you know in simple words, but our brain works in that way that we have three systems, brain systems. This is the limbic, reptile, and neocortex, which are responsible for certain actions of ours and certain emotions. The limbic system is about emotional brain, which is all about our self-defense, self-preservation, and it connects emotional and physical activity. The reptile part of brain is something that we faced when we heard the first explosions. All of us had a different response. Some started being closed in himself and just watching everything silently. Somebody was reactively packing things, documents. Everything was falling from the hands. He didn't know where to run. He didn't know whether he or she has taken everything. Maybe first come drugs, maybe documents, and here is the child. So different thoughts, in particular in the first hour after we were all informed that war has broken out. But this is exactly the system that is responsible for our reactive response behavior. And neocortex is trying to combine this left and right hemisphere, and it's trying to combine those two systems in the way for us to rationally realize, think over something, and make some conclusions coming from what we see and what we hear. And it's important to mention that female brain is 2.5% of the weight of the woman, and men's brain 2% of the body. Well, cases may be different, but we are talking about a relatively well-formed, well-developed person, mature person. And let me tell you what are the causes that lead to anxiety and uncertainty. Why do we feel this anxiety? What stimulates our brain? Why does it happen so? Doctors know about this, I'm pretty sure of this, but for all the others, let me tell that our body is built in the way that our organs produce cortisol that gives an impulse to the brain to warn about possible unpleasant events. And that's why we get this sense of anxiety as a result of this, the functioning of our adrenal gland. And the reasons mentioned here are lack of sufficient sleep, when we don't have sufficient rest the way we should, wrong food, wrong diet, when we don't have a balanced nutrition, when we eat fast food or just eat too much because of our fear, or when we need to go to sleep, we have such a high level of anxiety that we want to have some sweet or a sandwich or something like this. It's not very good because there must be a system, there must be a well-balanced diet. And that's what doctors keep telling their patients. Please keep to the balanced diet. It's not just written in literature, that's really for the sake of our good feeling. Lack of rest. Well, partially I already mentioned this, that if we don't sleep well, we have a unbalanced or imbalanced work schedule. I'm sure that we have all experienced this. And then there comes a bad day with lack of energy, we don't know how to move on. And the easiest, the simple things we can do, and I always tell my clients that they can do this, but to tell the truth, I am also a human, so I'm now trying to somehow watch my recommendations, follow my recommendations. So 2 hours before you go to bed, don't read the news. I understand that we have different circumstances, but it's just worth kind of having some rest for your brain before going to bed. It needs to get ready for the next day. We need to be productive on that day. That may be hot bath, hot shower, tea, something pleasant, something that can calm you down, make you feel relaxed. Everybody may have different tricks, different techniques, but you need to pay attention to that. Social isolation. When we don't find any energy in ourselves to communicate, when we don't find some time to spend it together with our friends, with our partners, and parents will agree with me that we know how to control our children, our adult children. We have been kind of taught to do this. We as parents know what to do, but if we analyze, and I would recommend everyone to do this, so if we analyze how I myself communicate with my child, what am I talking about with the child? Am I talking just on some live topics about simple things? Do I smile together with my child? Do I play? Do I have some walks with my child? Am I talking about anything else but for cystic fibrosis and some treatment? And you should, I've told you, you need to do this. So you need to control this. Sorry for my tautology, but you need to control this. I would just recommend all of us, and myself as well, to have this live communication with our children, with our husbands, and with our friends. This is really important and precious because generally a human is developed in the way that without social we will just go crazy and there will be no good results. So it's necessary to pay attention to this, not to forget about this. And of course, a lack of contact with nature is something that can also affect you in a bad way. There may be some fear, some uncertainty, some anxiety. So I think that we have all experienced this at some point. In this slide, you can see the graphic representation of what it looks like insufficient sleep, bad diet, fast food, some food which is not useful. Yes, we're all humans, and from time to time we may have some Coca-Cola and the chocolates, but we need to somehow take it into account that this should be from time to time, not too often and not too much in our daily life. Inflammation in the organism, we immediately feel, because our brain is built in that way, that it gives a signal that something is wrong. I feel bad. Probably today I need to stop communication with other people. I don't have to do any extra physical activity today or work too much. And in that way, we get some moments in life that can actually lead to this anxiety. No contact with nature, social isolation, so that's what you can see in the graphic format. But I would like to focus on the last element, last picture, which is lack of rest, lack of leisure time. We cannot always be over relaxed to be on the peak. Everything is dynamic in our lives. Sometimes we are really very much worried and concerned. Sometimes we are happy and merry, and that is okay. That is normal if we have this diagram of echocardiogram, just a normal structure, right? So, I would like to focus on the resources. What is a resource? It's a set of personal properties that enable the person to keep the sense of happiness, wisdom, certainty, confidence, and life experience. This is exactly the charging device that gives you the sense of support. These are kind of reserves that we can use when we need them. In simple words, this is exactly what we were growing up with, what we acquired and gained from our experience over the years of life that we have lived. That is something that used to support us and that enabled us to be the ones that we now are. And we should always also distinguish or differentiate between two components of resources, internal and external resources. Internal resources have partially been mentioned by me. This is the self-support inside us. That is something given to nature and something that we have acquired and gained. These are our skills, our character, our properties, characteristics. As far as external resources are concerned, this is our capacity, our social contacts and ties, support, and everything that helps the person from the outside. In particular, it should be mentioned that when we lose external outer resources, there is a imbalance in internal resources as well, and then we may feel this anxiety, lack of confidence, lack of certainty. That's why we always want to have those external and internal resources well balanced, and we want to comply with this harmony in our life. The core needs. There are much more of them, but I would like to outline the basic needs which constitute the basis for our internal ego. The care of your own physical and mental health, balance between work and life, or work and rest. And people who work in the field that requires a lot of work with people, other people, and if those people don't have special rest, this may lead to emotional exhaustion, to depressive conditions, to anxiety, and as a result, to psychosomatic mind and body medicine. I know that you are a neuropathologist, so sorry if I'm telling some things that don't make sense for you, but I was trying to somehow get ready with my presentation, not in an academic way, but a presentation that would be well perceived by everyone. And I would also like to say that we need to think at the things that we like where we relax, where we get filled from the inside. And this can be compared to a certain tree, a small tree. Our body is like a small tree that has been planted, and we all know that when we want to get something later, at the beginning, after we have planted this tree, we need to cherish it, to take care of it. We are watering it, giving fertilizers, so we are creating all the favorable conditions for this tree or this plant to grow to the best extent possible. The same goes for our body. And you all know that a person, when a child is born, the child can do anything on his or her own, nothing but for physiological needs. Which means that we were all taught something at the beginning of our life, and we are the ones that we now are, and that we have grown. And now I suggest that you personally take a test. We are not yet drawing anything, just have a look on the slide. And here you can see 7 types of trees. Don't think a lot, but just tell yourself what tree you have come to like the most. And I will read out who you are. I think that we will have the representatives of all those types of trees, so I will just be reading it in turns. So tree number 1, you're full of fear and you're really afraid of changes, unexpected events and problematic situations. It's important for you to do the planning of everything to the minutest detail. You need to have peace and stability in your life. Tree number 2, you're easy to be influenced, and the opinion of others matters a lot for you, and you are waiting for the evaluations of your deeds by people outside. It's important that you are loved and cared. That's why you don't want to stand out in the crowd, not to be criticized or not to make some of your friends sad. Do we have such people? I'm sure that we must have such people. Tree number 3. The thing you are most afraid in your life is to lose control of your life. You don't like dependencies and passive behavior. It's difficult for you to get adjusted to others and to comply with the rules. Sometimes you make a revolt in order to do everything the way you want. Tree number 4. You appreciate freedom very much and independence. For you, it is important to live your life the way you want and on your own terms. You are a very strong, confident, self-confident and willful person, but at the same time you distance yourself from other people. You belong to individualists, and sometimes you feel some problems in communication due to the lack of empathy. Tree number 5, you are full of energy and enthusiasm, but you are not calm. It's difficult to catch up with you, and it's difficult to understand the flow of your thoughts. You live here and now, and you irradiate positive energy even in the most difficult conditions. Love for adventures is something that is in your blood. That's why sometimes your decisions are hasty and wrong. And joy is your greatest power. Tree number 6. So, in the privacy of your thoughts, there are a lot of things that keep you from sleeping in the nighttime. You are contemplating about the things others generally don't pay any attention to. Quite often you feel depressed or sad. Try to shift your own. You are trying to shift your own problems to the secondary front to avoid stress and burnout. Tree number 7. You like being in the shadow, but you like attention. The most awful punishment in your case is ignorance. You're ready for a lot of things to stand out in the crowd, but when you're not noticed, this can lead to imbalance in your life. You like staying in the center of attention. And then I suggest that you draw your own tree. Please, do it. All of you have papers and markers, color pens. That could be any tree. And please draw this tree in the way that the roots are strong, nice, powerful, diverse. That is really important. So, how do you imagine it? It can be different, taking into account the previous picture. You have seen what it could be like, but please draw this tree, and I will be also drawing it to just understand in terms of time how much time you need to spend on that exercise. In fact, drawing is a calming exercise, even for those who can't draw, for example, as because I can really tell you honestly, I can't draw. Okay, you've done it already, great. So, those of you who are still drawing a tree, let's keep drawing, but I suggest that you have the roots. And the roots are our internal resource. Give the answer to the question, and please write under every root what it is. If you get some extra things that you want to add to the roots, just add the roots there and write it down. So what supports you now? What nourishes you now? What things give you this energy, the strength in your life? What keeps you going? What things make your life more stable? Do you plan your day? And when going to bed, do you think what comes tomorrow, how it starts tomorrow? Do you set an alarm clock for one and the same time? Because it's also about certain stability. The third thing, what exactly gives you the sense of security? What about your inner strengths? What gives you the sense of security? What do you do to feel secure? Do you have this sense of security? Maybe there could be a telephone call, or maybe you communicate with someone, you see someone, you spend some time together.
What gives you a sense of self-confidence? It may be experience, it may be the skill that you've gained over the course of your life. So, what are you good at? Let's imagine a situation. For instance, it started raining and you left your umbrella at home. So, how do you feel? Are you going to be irritated? Are you going to be angry with yourself for not checking the forecast? Or will you maybe stay calm and say, well, it is what it is. I'm in a hurry. I need to go and solve my issues. So you have a sense of instability. Despite the circumstances, you move forward with your plans. If you're already done with that, we can proceed to the next stage. That's the trunk of the tree. Everybody may have a different trunk, but your task is to answer the following questions and put that answers on the trunk. So, what do I choose to think about myself? How am I? So, anything that comes to your mind first, don't think for a long time. So, the first thing that comes to your mind, who am I? Number two, what do I want to think about myself? What do I want to think about myself? How do I want to treat myself? How do I want to take care of myself? Do I let myself have 2 cups of coffee in the morning, or is it just one? And if it's just one, then why? What do I do to feel fulfilled and self-confident? It may be a cup of coffee, or it may be going for a jog in the morning. So I let myself do jogging. It's not that I let myself, it's what I'm doing every morning, what I do every morning. I do exercises or something else. So, what do I do to support myself? I'm going to look at you to get a sense of whether you are ready or not. When the majority of you look at me, when you look up, then I will understand that you are done. The last question, what can I do to support myself for self-support? It's all written on the slide. When you come back home or on your way back home, you can come back to that tree, you can add new details. Because it seems that we all need a different amount of time to complete this task, but you don't need to be in a hurry, you just need to give answers to yourself. This will allow you to find the confidence that we need. All of us need this confidence at this time. Shall we move forward? Good. How about the crown of the tree? The crown includes the following questions. What contacts, what activities are important for me at this time? So it may be a goal that you want to reach, because if a person has a goal, then it means that they are motivated. If you are motivated, then you start doing something. And we can ask the following questions if we are talking about the crown. So, what activities, contacts, and plans are important for me at this time? Where do I want to channel my energy, my attention? What is important for me? So, where do I want to channel my attention? This is your subjective decision, something that you have decided for yourself. Who do I want to communicate with? Who do I want to meet? Are there any people that I didn't meet for lack of time, but I want to do it? What is important for me at this time? What do I want to do now? What are some of the things or tasks that I want to complete? What do I want to do? I want to share my tree with you, but I have to be frank with you. I drew it myself, and Isa also helped me because I'm not so good at drawing, so I needed help. My tree is nice, but let me show it to you. So, in case you're interested, this is my tree. It has this really broad trunk. Perhaps we won't have enough time right now, but at home, I recommend that you color the tree, that you color the crown. It's really important, depending on how you're feeling, depending on what your social connections are. Your crown will take a different appearance. So it may have flowers, it may have leaves or not. It may be green, or it may be a tree during fall, or it may be just a tree during winter time, or maybe it's the springtime when life is born. All this is a manifestation of your inner state. And you can then look at this tree and answer for yourself. Do I have the power? Do I have the strength to do what I want? And taking into account the circumstances under which we are living and the situation in general, it's recommended that we pay attention to the resource of security and safety. And when I was preparing this presentation, I was thinking about 6 components. And for me, it's a manifestation of a palm or a hand. So you can draw your own hand. And now we need to sign. This is up to you how you do it. So you need to decide what physical safety is for you, and do you feel this physical safety? So answer this question. Do I feel physical safety? Am I safe? You can choose any finger that you want. Number 2. Do I feel emotional safety? How do I feel? How do I feel? How am I feeling now, rather? The material component. It's not about the money. It's about having a place to sleep at. It's about having the opportunity to rest for 10 or 15 minutes after a conference. Am I in a rush? So, how are you feeling? So, right now, let's think about the moment right now. So, do you feel this material safety? Control. You can pick any finger. So, this will be the finger that's responsible for control. What do I control? Are there things that depend on me? Are there things that I can influence? Are you done? No? Are you still thinking about the answers? So you can just put down control on any of the fingers, and then while traveling back home, while being on the train, if you feel bored and there's no internet connection, you will have the opportunity to expand on that thought. So what do I control? What do you control in your life? It's not about your relatives, not about your close family, but about yourself. What do you control? What can I influence? That's the fifth finger already. Alright, but normally people have 5 fingers, not 6. Do you all have 5 fingers and not 6? Well, the sixth one is the wrist. So what is happening in my life? And it's really interesting. I'm going to ask you one more question. It just came to my mind. So please, you need to put down whether this is your left hand or your right hand. It's also important. So put down right or left. And then I'm going to tell you what it means. It may be different. It may be like a mirror reflection. So it may be either the left or the right hand. So in your opinion, is this your right hand or your left hand? Done. So if this is your left hand, it means that you're a person who relies on their own experience, on the things that you have gained throughout your life, on the things that give you confidence. That's about the left hand. If you put down right hand, that it means that you are looking towards the future, you believe in the future, you believe that you will succeed, you believe in the circumstances that will inspire you in the future. And you hope that you will be able to achieve everything that you want. And finally, it will be the third drawing. Do we have enough sheets of paper for everyone? That's enough, I hope. So the task is to draw the sun. The sun with the rays. Make sure that your sun has rays. It may look like the sun on the slide. The sun to the left, where you have fewer rays, and then to the right, there are many rays. It's a sunny weather, but it does not have to be like that necessarily. Just draw the sun in the way you imagine it, in the way you see it, but necessarily with rays. Ladies, front bench, you will be answering in front of the blackboard. You are done with the task. Okay, good, very good. So the rays are to be used 4 adjectives. These are the adjectives that characterize your strengths. So try and pay compliments to yourself by using some positive compliments. So I am beautiful, I'm successful, I'm honest. So you can use different adjectives, but you need to have at least 5 rays. The more the better. Pay compliments to yourself. If nobody pays you compliments, then I can do it. If it's difficult for you to think of adjectives, just ask your neighbor, how would you characterize me? If it's difficult for you to come up with adjectives and you find it hard to pay compliments to yourself and you cannot answer the question who I am, include as many positive adjectives that can characterize you as possible. Have you completed the task? Not yet. Okay. So here on the slide you can see 2 drawings of sun, and in the middle you can see a woman planting something. Why is that so? It should be mentioned that we are all like a seed that was born one day, then we were taken care of, then we were raised, and it all depended on a number of factors. Of course, we are all different. But what is important is that throughout our life, we need to focus our attention on who we are, on what we can do, and how we behave in difficult situations, what our responses are. And the rays of the sun that you've drawn, I recommend that you take a picture of your drawing. And when you feel down, when you feel anxious, when it's difficult and you feel bad altogether, and you experience any of the 6 reasons that cause anxiety, we've discussed this already, so go back to this drawing. Look at this drawing of the sun and just pay compliments to yourself. It will be inspiring and it will make your life more stable. I'm asking you to keep the drawings. Don't throw them away and just go back to them once the conference is over and you're back home. Go back to these drawings. You can add some details and it will be useful when you feel stressed, anxious, when you lack confidence. So just remember about the exercise that we were doing today. And finally, let me tell you one important thing. It's a saying by Sigmund Freud, and it says that the only person that we should be comparing ourselves with is us in the past. And the only person that we should be better than is us in the present. And towards the end, I would like to ask you, because I cannot do it as I'm holding the mic, I'm asking you to open your palms and just to clap, to thank yourself for the work that you have done. It's gratitude for the work over the past 2 days. I hope that you liked everything. I hope that I was able to improve your mood regardless of the circumstances. I'm really grateful to all of the online participants. And let me just say glory to Ukraine, glory to heroes. We're going to finish, to conclude with our anthem, and I wish all of us to experience victory at all fronts, and thanks to the armed forces of Ukraine for defending us.
I'm so grateful to everyone for these 2 perfect days spent together. I'm grateful to the armed forces of Ukraine that they have given us the opportunity to spend this conference. Thank God, probably God knows what we have been talking over those 2 days, and we had a chance to hold this conference without going to the shelter. I'm grateful to everyone who has stayed with us for these 2 days, either offline or online. And I would like to tell the main things: stay safe, take care of yourself, take care of life. There is nothing more precious than our lives. Until we live, we can overcome any obstacles. Let me hug each of you mentally, all those who are offline and online with us. And with this, we will finish our broadcast. And in the nearest future, we will broadcast this conference on our YouTube channel. And all those who fail to come here will have a chance to look into languages at the presentation. So thanks to everyone, and glory to Ukraine, glory to heroes.